Good afternoon, everyone, and thank you all for tuning in. We're going to start this afternoon's briefing with some words from Dr. Levine. Dr. Levine.
Thank you, Governor. I'd like to give you a little bit of an update on where we are in Vermont. Over the weekend, the numbers did have a spike upwards, and now we've gone from 52 to 75 positive tests in the state. Unfortunately, and we send our condolences to all of the families involved, our deaths are now 5 in Vermont. There were 3 additional deaths over the weekend, all relating to the outbreak at Burlington Health and Rehab. When we look at the data, there's clearly trends. As we've increased our test capacity, we are having more positive tests. That should not be a surprise to anyone. And countries that long ago had higher test capacity saw this happen reliably. Many of our tests, other than those that we've termed the highest priority, which remain in our state public health lab and have a rapid turnaround time, many of our tests are now sent out to commercial labs, and we've begun to see some of the results from those test results. And a number of the positives, excuse me, are in that group, and to us that indicates that we're seeing more sustained community transmission of COVID-19. Since I know I'll be asked about this, I thought I'd give you a brief update on the situation at Burlington Health and Rehab. Total number of patients that had positive tests were 14, and only 1 staff member. We've been actually doing a lot of proactive additional steps to bolster what the facility in reality is and was already doing. And we found no fault in their infection control practices or procedures. We've advised them on them. We've observed them. There are various aspects of how they cohort and separate patients with different risks and different test results, and they're doing that very well. There may be an opportunity in the very near future to have a select group of patients leave the facility, ones that were not there for the long term, so to speak, were there more for the rehabilitative aspects of their stay. Staff are all being asked and required, as our own staff have found out, to have their temperature checked as they go into the facility. And obviously, if they have a fever of any sort, they don't go to work then. We've been in touch with the CDC innumerable times. Most recently, I was on a call 9 o'clock last night, and we continue to hear their guidance. They continue to tell us that we have always been following their guidance and that we're doing a fine job. And they have no desire to come here because, as I've said before, they have numerous outbreaks across the country in long-term care facilities as a result of the COVID-19 problem. My last comments will just be more philosophical, if you will. This is really an unprecedented time. We've asked Vermonters to socially distance. We've asked Vermonters to change everything about their lives in a very, very constricted period of time. I can tell you from my own observations, and I had to go out and do some errands yesterday and buy some things, and people, even when they recognized me, were respectful. They did not come up to my face to talk with me. They spaced themselves appropriately. They understood that. I know we're not hearing that in every quarter of the state and every person that lives here, but I do see remarkable change in a very, very short period of time, which I think is commendable. You know, in public health, we use some terms that don't sound so good in this kind of atmosphere, like isolation and quarantine, segregating a portion of our population. And when we say terms like social distancing, they don't sound maybe quite as negative, but they certainly don't sound very inviting either. And so I want us all to remember that, when I talk about public health problems in Vermont, I also talk about them sometimes that their root is in social isolation. We're not looking for social isolation. We do want people to be physically not as connected with each other as they were, but that does not mean that they need to be socially isolated from them. And it really means that all of those creative ways in modern technological times that we connect with one another, we need to take advantage of those more than ever before. And it's our goal at the health department, and I think as a state, to really try to help our population with that real difficult challenge of staying connected with one another, helping one another, being cooperative, but at the same time, having that sense of volunteerism and creativity that will really help us all get through this. With that, I'll turn it back to the governor.
Thank you, Dr. Levine. As the doctor just outlined, as we all expected, we continue to see a rise in cases as we test more Vermonters, and we know these trends will continue. On behalf of all Vermonters, I give my deepest sympathies to those who lost loved ones due to this pandemic. That's why our mission has been to do all we can to slow the spread of the coronavirus. Reality is, many will be affected, infected, but will only experience moderate symptoms. But the conditions are much more severe, and the risks are greater for the elderly and those with chronic health conditions. The precautions we're taking are to protect our loved ones and neighbors who face greater risks. And to win this battle, we have to do our part, all of us. It's literally in our hands. At the state level, we've done a lot to make sure people are social distancing, including limiting the size of social gatherings to 10, dismissing schools, closing daycares, restaurants, bars, gyms, hair salons, and much more, as well as other efforts to slow the spread. But as I said last week, we're going to have to do a lot more before this is over. And I want Vermonters to start preparing for even more difficult measures. We're now entering a new phase as we try to flatten this curve. Today I signed an order to require businesses and not-for-profits to implement every work-from-home procedure they possibly can so their employees can stay home safe. Vermonters should also expect additional steps very soon that will further reduce contact and direct more to stay at home in order to slow the spread. It's not a question anymore of if, it's a question of when. To be clear, all of us should already be taking personal responsibility to physically distance ourselves from others and to follow the guidance in place to help keep each other healthy. The state is further preparing as well. For example, I've directed the National Guard and our state med-surg team to work with the state EOC to stand up the first of 3 medical surge sites. While we hope we don't have to use them, we must be prepared for this possibility. I know the actions we've taken and those yet to come are difficult, which is why we're also expanding unemployment benefits, helping small businesses with emergency loans, and other initiatives to help support people through these challenging times. But we know government doesn't have all the ideas or solutions. It never has, it never will. And just like during Irene, it's the ingenuity of Vermonters, the creative spirit, the energy and work ethic of our people that we need now more than ever. Here's what I'm asking of businesses and nonprofits. If your organization is still open, look at our needs and ask yourselves, what can I do to help? there are still important jobs that need to be filled. So it may take some creativity and flexibility, but finding ways to get things done while social distancing can make a big difference. We're seeing this across the state, from businesses finding ways for employees to work from home, to restaurants with curbside pickup and grocery stores creating special hours for the elderly to shop. And we're seeing generosity as well. Last week, I put out a call to private companies around the state asking for donations of personal protective equipment for our healthcare field. By the end of the week, Casella, Edlin, General Dynamics, Global Foundries, Pompanusic Mills, the Church of Latter-day Saints in Sharon, and many others had answered the call with donations of masks, gowns, and monetary contributions to protect our healthcare workers. As another example, the Vermont State Police, with the support of local businesses like Cold Hollow Cider, Twincraft, and Autumn Harp, have been producing hand sanitizer. And I know we have a few distilleries doing the same. And the Williston Fire and Police Departments are giving Facebook Live tours of their equipment to entertain kids learning from home. The point is, this is the time to tap into your creative spirit, which is in the DNA of every Vermonter. To everyone across the state, this is an opportunity for each of us to step up and join together, even as we must be physically separated. We can unite to help those in need, and we need everyone to think outside the box and find creative ways to do that. Pick up a meal for a neighbor, provide books or other resources for young kids, or make a video to read to them. Send cards or messages to your local senior center, or donate to a local charity like the Vermont Food Bank, Meals on Wheels, along with so many others in need. And by the way, when you order takeout, make sure you tip them well. They could use it. We need to take bold actions to defeat this pandemic, but we also need small acts of kindness and goodwill as well. This will deepen our resolve, preserve our faith, and strengthen our connections to one another. We cannot allow the physical separation to pull us apart. Instead, we need to use this moment in time to come together in other ways. So today, I'm asking you for your help. And here's your mission. Help your fellow Vermonters in their time of need. And I realize much of this is already happening. But just like government needs to do more, we need each of you to do more as well. That's how we're going to get through this and put Vermont in a position of strength when this is over, because it will be over at some point. It may be a long haul, but it will happen. All the small initiatives and acts of kindness make a huge difference. The bottom line is we need each of you to find a way to help, to contribute in whatever way you can to help pull us together. Stand united as Vermonters. I'm so very proud of this state, and I know we're going to get through this. Not because of any one person or any one action, but because of each of you. So with that, speaking of partners, I'm very pleased to have Congressman Welch here with us today. Senator Sanders, and Senator Leahy, who I spoke to just before I came down for this briefing, have been very supportive of our work and leading additional efforts to help Vermont at the federal level. So now I'll ask my friend, Congressman Welch, to say a few words.
Thank you, Governor. Thank you, and thank your team. Thank the Guard, the retailers and grocers, and thank you, Vermonters. The Governor has been speaking about what each of us can do in what appears to be an overwhelming situation. And the message that he's giving us is that any action we can take that helps ourselves, our family, our neighbors, that's an action worth taking. But there's also an action that the federal government has to take. This is an unprecedented challenge. We have a pandemic, and the recommended way of protecting our health is to compromise our economy. People can't go to work. Businesses are closed down. People who had a job now don't. And we know that we've got to take the steps required to protect our health. We've got to do it no matter how painful they are. But we also have to be looking over the horizon to address the economic challenges that we've had to suffer in order to protect our health. And Washington is the site of the federal government, and that federal government belongs to the people of this country. And if ever there was a time where it had to act on behalf of everyone, it's now. The main responsibility that the federal government has is to provide the funding so that our families are secure, our hospitals are secure, and our businesses are around to fight another day. The job we have is complicated and difficult, but it's not as hard as the job that the frontline health responders have. It's not as hard as the job that a family has where they were working and the mom or dad comes home Tuesday and says, I don't have a job any longer. It's not as hard as those folks showing up at the hospital knowing it's a risky environment where they've got to provide that health care. That's what is going to ultimately sustain us. But we have a job in Washington to be the banker of last resort. And the legislation that we're now considering, up to $2 trillion, has as its focus 4 things. Number 1 is individuals. How do we protect individuals? I spoke to the head of the Farmhouse Group, very successful restaurateurs. They went from having 250 employees on Monday to 4 employees on Tuesday. Think about what that means for the security of those families. So we want to extend and expand unemployment insurance and add about $600 on top of what the maximum is, which the governor tells me is a little over $500 here. Have that on insurance apply to folks who are independent contractors, that's your Uber drivers, and to self-employed, folks in the past who've not qualified, but whose incomes have collapsed. There's discussion about direct payments to individuals. And that may be included, and if it is, I'd be glad to support it. But I actually think doing something that's sustainable is better than doing something that's one time. If a family has an income of $50,000 a year, a $1,000 check is 1 week. And this is going to go on longer than that. That may be part of it, but that's why I believe that expanded unemployment insurance, paid for by the federal government, is really essential to provide some stability to individuals. We've got to improve food security. All those kids and all those seniors who are dependent on those meals have to make certain that the regulations that would prohibit them from getting those meals when they're not in school are swept away. I know the state's working on the delivery of those meals for kids. But that is something that's really essential for lower income Vermonters. There's also a desire to have a moratorium on debt repayment for 3 months. Folks with credit card bills and the interest mounts, those late fees are brutal. Students who are in the process of repaying loans, those interest rates are tough. Car loans, all of these things that are everyday obligations that people have and they meet their obligations are now a real challenge, and we don't want those families to come out on the other side of this with ruined credit and no opportunity to get back on their feet. Small businesses. I've spent a lot of time in the last several days on the phone with owners of small business. I mentioned the Farmhouse Group. But, you know, there's just a very vivid, real example. There's a restaurant in Norwich where Margaret and I have dinner like once a week. It's like our date night. And Bruce had to lay off his 14 people. And what he's doing now is doing takeout meals, and I like your idea of tipping. But I also like the federal government doing a little bit more than that. I like the federal government giving a loan to Bruce and small businesses that can become a grant when he uses that money to maintain his payroll. Because one of the challenges we face with these small businesses that are so essential here in Vermont is that when the lights go back on, when we can go back into those places, where will their workers be? In some cases, they won't be here. So we want to make it possible for them to open those doors on that day when it's okay, public health-wise, to go back. Third, our hospitals. Our hospitals are so essential to getting our folks through this and essential to our way of life here in Vermont. Our community hospitals are vital institutions, as is the medical center. They're under enormous strain. Why? They have been told and required to essentially stop elective surgeries. And for our hospitals, by and large, the difference between red ink and black ink are those elective surgeries that are part of what they do. Why do they have to withhold on the elective surgery? It's because we don't have the mask and the personal protective gear that will be necessary as the surge of patients with the virus start entering into the hospitals. So their financial situation has nothing to do with any business practices of theirs. It has to do with the federal situation we face of this virus and having to have these hospitals be available for when those patients come in. So we're having a discussion now with a bit of a debate about whether that should be a $75 billion or $110 billion payment that's available to stabilize the finances of these hospitals that are helping us get through this. That would also include finally trying to get enough personal protective equipment that's essential in testing equipment that obviously is essential. And then finally, we have to have state aid. The federal government has to help our state partners. Governor Scott and his team are on the front line. And the cost to Vermonters as taxpayers is going to be significant. We believe, Patrick, Bernie, and me, that really the federal government should be the one that's paying the expense associated with what is in effect a national emergency. We can't impose that and shift it to a state, any state that's already overstretched. So I hope we're able to deliver on that, Governor Scott. And then finally, we've got to have oversight on this. I mean, it's not, the mistakes will be made when you're doing something as quickly and as momentous as this. But on the other hand, that's no reason to not have accountability. So that's the approach we're going in. There's differences among legislators about how best to do it, but there's a consensus that we have to do it. And I think there's an emerging consensus that to the extent that the federal government is involved, it has to be the payer of last resort. We can't impose this on the states, on the communities, on the small businesses, on the hospitals, on the individuals who are all rallying to meet our public health crisis. So thank you, Governor, and it's a pleasure to work with you and your team and to be a small part of trying to help us get through this. And now I want to introduce the head of the Vermont Retailers and Grocers Association, Aaron Segrist. I really appreciate what you all are doing. You're on the front line, keeping us fed. God bless the retailers, and God bless our healthcare workers. Thank you for being out there interacting with the public at a safe distance. Thank you. Aaron?
Thank you. Thank you very much. I am Aaron Segrist, president of the Vermont Retail and Grocers Association. It's incredibly difficult to follow such steady and fantastic leaders today, but thank you both Congressman Welch as well as Governor Scott for joining the association in encouraging consumers across the state to remain calm, and thank you for your leadership during this time. Last week, the Vermont Retail and Grocers Association sent around the state word to encourage retailers and grocers of all sizes to designate specific hours for vulnerable populations, to provide, as well as provide alternatives to shopping, such as curbside delivery or even home delivery in certain aspects. We also continue to encourage consumers to please respect these designated hours. You can find a growing list of those businesses providing designated hours or other shopping alternatives on our website at vtrga.org. We're doing our best to make this list as comprehensive as possible. It will change throughout the day on a daily basis, but please, again, visit vtrga.org and you will be able to find stores within your communities that are providing designated hours as well as alternatives to shopping. We also would like to take this time to urge customers to remain calm. I understand that these are uncertain times, but we're all trying to do our best to get through this as best as we can. We ask that you take a little bit of precaution where necessary. We need to rest and reset and remember that the food and other necessities are available. And we ask that customers go back to shopping as you used to, in the sense that we ask that you don't hoard. We ask that you shop for 2 weeks, which is recommended by the CDC. Again, 2 weeks instead of 2 months. The shelves were stocked and plenty of food was available when we were shopping before this uncertain time hit. If we continue to buy more food and toilet paper and supplies necessary, it limits the ability of our neighbors to remain safe and healthy as well. Again, the shelves may look empty at various stores, but food and other products are available. We urge everyone to refrain from purchasing more, again, than 2 weeks at each visit. It's imperative that we revert back to how we used to shop. Additionally, grocery stores especially are on the front line during this pandemic. If you're sick and you go to the doctor, it's a controlled environment, and everyone involved is able to take certain steps to protect each other. We don't have that luxury on the front lines. We don't know if someone is contagious, and so again, we ask that customers who may feel unwell, please stay home. And we are here to share with you that stores are providing alternative methods to shopping and doing everything they possibly can to ensure your safety as well as their employees. And finally, because we don't have the luxury in stores to know if someone is contagious, we've implemented additional steps to ensure, again, that you are safe. Additional cleaning throughout the day, plexiglass guards at certain checkouts around the state. Employees are wearing gloves where possible. However, we all know that there's a shortage of personal protective equipment. It's inevitable that stores will have employees that will become infected. And this is again why we are asking that you practice the CDC guidelines and understand that these grocery stores especially are doing everything they can to protect the public and employees. If an employee becomes infected, stores are already doing everything they possibly can to ensure that they don't, but if they do, they're working hard to implement practices to ensure that they are disinfecting as quickly and swiftly as possible. We ask that you understand that this is inevitable. We ask that you understand that that the true Vermont spirit is also neighbors helping neighbors, and we will get through this. We all just need to rest and reset. Thank you again for our leaders up here. Thank you, Governor Scott. Thank you, Congressman Welch. We certainly do appreciate your support during this time. Thank you.
Thank you, Aaron, and thank you members for us. Typically in a crisis or an emergency, we think of the first responders as typically the police, the fire, and EMTs and so forth. But in this crisis, I think we have to add a couple, and I would add those in the grocers that are providing the food that we need, as well as the custodial staff that is providing a need for us as well to make sure that we're protected. So in different times, we have to look at different people for help, and I'm happy to see that they've stepped up. We'll start with questions at this point in time.
Great, thanks. Again, for those on the phone, please wait for your name to be called. and then hit star 2 to unmute yourself. We are a little rushed on time, so please try to answer questions that have not been asked before. I'm going to start with Joe from the Barton Chronicle.
Star 2, Joe. Maybe we'll come back to Joe.
Alex, Journal Opinion. Star 2 to unmute yourself. Anne, VT Digger. Star 2.
I'm assuming we might have a problem.
I heard it really faintly there. So they may need
It's
to,
up all the way.
Anne, VT Digger.
Why don't we take,
Keep going. Let me try Wilson, AP. Star 2 to unmute yourself.
why don't we take questions to start off with while we try and fix this issue?
Sure. So that'd be Kat.
All right. Governor, is there any sense of how to quantify how much our economy has already idled because of this? I don't know if you can do that either as a percentage of the economy or the number of people.
Yeah, very difficult at this point in time to determine, but suffice it to say, these are going to be very challenging times for our economy. That's why I'm so grateful for some of the approach Congress is contemplating. This will be necessary to take care of our workers.
Can you hear me okay?
I can now. If you could just hold for just a minute, Ann.
Can you hear me okay?
Ann, if you could just hold for a minute. That's why I'm grateful for the congressional delegation and what they're proposing. This will be a tremendous boost for us. This is going to take, it's going to be a very long recovery in some respects, but with their help to put a reset on where we were before would help us incredibly.
So we don't, though, have a number from the tax department?
Not at this point. I mean, there has been all kinds of projections, but I'm not sure that anyone can determine that because it really depends on how long. If some had said in the beginning that this was going to be a short period of time, maybe 2 or 3 weeks, but this is not going to be 2 or 3 weeks. This is going to be for the long period of time, months, I believe, before we're even through the initial surge. And then at that point, it's going to be a slow recovery. So it could be a long time.
Anne, VT Digger.
Ann from BT Digger. Let's take another question from the floor.
Right here, sorry. So you said that we need to be preparing for more difficult measures. Would a stay-at-home order be something we should be preparing for?
Yeah, I think when you're looking at what other states have done, we have the luxury in some respects of seeing in real time the epicenter, which is in New York, certainly what New York and California, New Jersey, Connecticut, and others have done is going to be fairly widespread, will be coming next, I believe, as well as our neighbors. I'm in constant contact with Governor Sununu, Governor Baker, Governor Hogan, and others, and watching again what other states are doing in order to determine when the right time is to do this as well. Speaking with Dr. Levine almost on an hourly basis about what we're seeing on the ground here. Everything's based on data and science. We took a measured approach going into this, and once we get to a point where we're on the other end, we'll take a measured approach as we proceed to recovery. So this is what we're contemplating.
Hi, can you hear me okay?
There's no specific timeline, though?
Oh, it's going to be, again, not a question of if, it's going to be a question of when, and I would expect it will be in the next couple of days. We want to give people, I think it's important what we've done thus far in giving people time to prepare emotionally, mentally for what's happening, and making sure that we're ahead of the curve in what we're seeing. We're taking all the data in, and again, we think we've done this correctly, and we're just making sure that Vermonters are prepared for what's next. Once we prepare them, and they see that stake in the ground, they're prepared to do whatever's necessary to get through this, and that's what we've tried to do. Take a really measured approach to this crisis.
Stuart?
I was going to ask about that. Can you talk a little bit about the nursing home facility there? Are other nursing home facilities, other long-term care facilities at similar risk now? Is there anything that others can do and learn from Burlington Health and Rehab?
Yeah, I'm going to let either Dr. Levine or Secretary Smith answer this, but I will say, as I've said from the very beginning, we know the elderly, those with chronic illnesses, are at risk, all of them. So we know that our nursing home and long-term care facilities are something that we've tried to protect, and will continue to do so because they're the ones who are at most risk. So, Dr. Levine? Or Secretary Smith?
Mike Smith, Secretary of Human Services. As you know, when the governor issued the state of emergency, we really clamped down on access to nursing homes and long-term facilities. Similar to the Burlington Health and Rehab, we clamped down very strongly on visitation and that sort of access to it. So we started initially with that in terms of no visitors except in end-of-life situations, no visitors to that facility. And yet you see how severe the situation is when you have an epicenter in a facility that is that has people that are elderly. This is what is the issue here for those who don't take this seriously. This is the seriousness of it. This disease does not affect, it has limited effect on 80% of the population in terms of moderate to mild symptoms with this disease, but it has tremendous effect on those that are older and elderly. And that is something we have to protect. That's why we put those restrictions into place to begin with. I'll leave it to Dr. Levine to expand on that.
Well, just briefly, so visitation policies are critical, and they're spread from not just the long-term care facilities, but hospitals, other acute facilities. Second is the workforce, making sure that the workforce is healthy, making sure that no one in the workforce feels uncomfortable staying home, that they might lose their job or what have you, because the fact is no long-term care facility wants to have a problem occur like we're seeing now. And workers take personal responsibility, which is some of it, to stay home. And as I pointed out with the current facility, you can't even arrive to your job if your temperature hasn't been taken at the front door. So those kinds of policies are really, very helpful. I would add that we have no reason to believe at Burlington Health and Rehab that neither a visitor nor a employee was the reason for this to have occurred. And we're trying to do some of the detective work behind that right now, but there's nothing obvious that has come out related to any policies.
Have all the staff and residents there been tested?
The appropriate ones have been tested,
But not
and not everyone.
Can you give us a sense of how many, what percentage of staff and residents have been? Have not?
No, I can't, because I don't have the total number of staff that they have.
I have a second one since we're able to ask another one. We've been hearing a lot of emails from people who are concerned about a lot of people coming into Vermont to stay at their second homes, trying to get out of places like New York City. doing anything to assuage those fears that some people have that people might be bringing the virus in from places like big cities?
Yeah, I mean, the reality is we're all in this together across the nation. We're trying to do whatever we can to socially distance ourselves. But we've taken, we've had a lot of second homeowners over the years, and they have their homes, they utilize our services, we provide them with all kinds of things, and they provide us with all kinds of income as a result. We're not going to turn our backs on them, but certainly we're discouraging folks from coming to Vermont to escape what they have had to endure in their own homes, hometowns, and villages. But at the same time, once they're here, we're going to take care of them. We're all in this together as a nation, as humanity. We have to stay together on this.
And it's worth saying, there's sufficient community transmission occurring right now that it's throughout a population. It would be very, very unfair to point a finger one way or another. Think about all the travelers who have come back from vacations in European countries at a time when our country allowed them to just come through the airport and go home. We could blame all of them as well. But this is a worldwide pandemic, and this is how pandemics evolve. It does call for perhaps, though, a coherent national policy, I would say, so that state by state, each state didn't have to sort of invent their method for social distancing and try to make that work for their population, because we know that viruses have no respect for state borders. And we know that our borders with New Hampshire and Massachusetts are very fluid, and there's a lot of commerce that occurs across those borders, and people don't even know they're crossing a border when they go to their favorite restaurant or what have you. So it's very challenging if a region can't have a similar policy across the region to really have the ultimate in success with these kinds of social distancing mitigation interventions.
Yes.
I have another question for Dr. Levine about testing capacity. You spoke earlier about the increase in testing capacity, the ability to send tests out of state. How is that affecting the turnaround time? Like an average Vermonter who goes and gets tested, when can they expect to get results back on that test?
Yeah, so from the state lab, they can definitely expect within 24 hours. From the send-outs, it's a moving target. So we've gotten some back very quickly. We've gotten some back in 48 hours. People are telling us they're being told 4 days, and I haven't seen that play out yet, but we need to watch that closely.
We have had readers contact us and say they've waited 4 days or more.
Yeah.
What can be done about that?
Right now, increasing the capacity of the local labs that we have here, which means having all of the appropriate reagents and extraction devices that are needed, having the appropriate number of collection kits, working very closely again with our partnership at UVM Medical Center. All that will help enhance our opportunity to have a very rapid turnaround. But I don't want to throw the commercial labs under the bus, because they're indispensable now in our ability to do surveillance on this evolving epidemic and really get a handle on things and allow people to identify themselves as afflicted or not afflicted and take the appropriate steps.
We also know there are a lot more samples being collected at more locations around the state.
Yes.
Are those all getting actually tested at the same pace? Or are we looking at some kind of a bottleneck right now where there's more samples coming in than we can test on a given day?
No, but see, so the high priority ones are staying here, and the lower priority ones, and there's a specific guideline for who is higher and who is lower, are being sent out. There was, in the very first day or two, a backlog in terms of we didn't know where we could send them at that point in time. Now there's a very fluid, smooth process to get them in and move them out.
Time for a couple more questions. Sorry, I'm going to have Brittany and then Stuart. Governor, just a quick question. Have you been tested for the virus yet?
I have not. I have not had any symptoms. Obviously, I'm doing everything I can and watching myself and making sure that I'm washing my hands dozens and dozens and dozens of times a day, and making sure that we're staying away from each other. But I haven't had any symptoms at this point.
Stuart?
Governor, could you just clarify, we can expect a shelter-in-place order from you in the next couple of days?
I would not describe it as a shelter in place. That terminology means something different to many people, especially in the emergency world. What we're going to advocate is just what we've done thus far, and it'll probably take another step. But we want people to stay at home when they can. Right now, you have a responsibility. If you can stay at home, stay at home. But we're going to take further measures to make sure that those that can or should are, and that we're allowing some of the essential services to continue.
And can I just follow up? Is there anything you'd like from the legislature tomorrow as they try to cobble together a session?
Yeah, we've been working hand in hand with the legislature, and I want to give a lot of credit to them. They're trying to take care of whatever needs we have at this point. We're going to need some more. There's all kinds of issues that will need their input, their actions, and we'll continue to do that. So I really appreciate. We've again put whatever partisanship, whatever debate we have aside to do whatever we can together to help Vermonters. Yeah, sure.
Just on, you asked the question about the economy. This is where the federal government has to be aggressive. Secretary Mnuchin indicated in a conference with the Senate that we could have unemployment of up to 20%. And it's only the federal government that has the capacity to respond in a big way that's going to help our states, our small businesses, and our individuals get back on their feet. And my view is this is a situation where it's much better to do too much too soon rather than too little too late. And I hope that is a view that prevails in Washington. But I want to thank you, Governor, and all of Vermonters who are on the front lines.
Again, that'll wrap it up. We'll be back with you on Wednesday. If anything else comes up, we'll certainly gather again in the meantime, as we've done throughout this last 3 weeks. We react when we need to, when we see the data and the science telling us what we should be paying attention to and what we need to do immediately, and we've done so. So stay tuned. I want to apologize to those on the line. We'll figure all this out, and we'll make sure that your questions are answered. Thank you.
The David Pakman Show at davidpakman.com.
The big political story over the last 24 hours, Bernie Sanders has suspended his 2020 Democratic presidential campaign. There's just so much to talk about. And I've received hundreds of messages since yesterday about this, emails, tweets, all sorts of other messages, Instagram. And so I want to go through this in sections. I want to make sure we cover everything. I want to make sure we sort of turn over every stone that needs to be turned over in thinking about this and going forward. And so we're going to talk about Bernie's decision itself and whether it made sense. We'll talk about what exactly happened in the campaign that at one point seemed to be going so well. We'll talk about what this means for the progressive movement and for the future of who the individuals are that may be leading that movement. We'll talk, eventually, we also have to talk about what this means for November of 2020. So we're going to get to all of those things. Now, my concerns from the messages I've received are centered around, I guess, generally that a lot of these different issues I mentioned are being mixed up. For example, there are people mixing up questions about the future of the movement with November of 2020, when there is overlap, but really there are different decisions and different considerations to be made there. And it's leading to some unclear thinking and people that I think are not thinking in the clearest terms about this. And I want to make sure that if nothing else, we can disagree about where we end up, but let's make sure we have all of the facts and that we're thinking clearly and discreetly about all of these issues. If we come to different conclusions, that's fine. I have no problem. We're adults. But let's think through the different elements of this. First of all, here is Bernie himself saying it yesterday that he is suspending his campaign.
I wish I could give you better news, but I think you know the truth. And that is that we are now some 300 delegates behind Vice President Biden, and the path toward victory is virtually impossible. So while we are winning the ideological battle, and while we are winning the support of so many young people and working people throughout the country, I have concluded that this battle for the Democratic nomination will not be successful. And so today, I am announcing the suspension of my campaign.
So, first of all, was this the correct decision for Bernie Sanders to make? The answer is yes. Now, Bernie talks about the math, and he says that he has no path to the nomination. It's important to understand that it's been weeks since the numbers changed. So if the numbers yesterday show no path to the nomination, he also had no path weeks ago when we outlined that, and still many people were reacting very emotionally and sort of resisting that. After Super Tuesday, Bernie's shot was diminished to about a 1% shot. After the March 10th states voted, he had about a 0.5% chance. After March 17th, it was smaller than a 0.1% chance, and that has not since changed. So Bernie's decision is the right one. Bernie's decision is backed by the math, and there's no question about that whatsoever. Remember, even after it was just Biden versus Bernie and everyone else was out, Biden kept building bigger and bigger leads in the polls. There was the idea that coronavirus would turn it around and reinvigorate Bernie's campaign. In the polls, Biden kept pulling away. So that's that. I don't really think there's that much more to say about it, particularly because Bernie has suspended his campaign. Next question is about the timing. Bernie getting out yesterday, April 8th, as opposed to earlier, as opposed to later. I don't know that this is the most important issue, but I'm not so sure about the timing. I mean, to me, again, the numbers haven't changed for 3 weeks. So in a sense, it might have made more sense to get out 3 weeks ago when we were not in the middle of the peak of a 100-year pandemic, where this is likely to be a story that gets 24 to 36 hours of attention, and then the attention is going to be greatly diminished. Waiting, I mean, listen, if you've waited this long, maybe you just keep waiting with no other primaries that are voting in person in the immediate. Maybe you keep waiting with the idea that when the virus starts to settle down in the news, as hopefully it will in the next month, although we don't know, maybe there's an opportunity for Bernie to get more attention with this, get some concessions or something with Joe Biden that will be a show of both unity and maybe also some policy concessions that Joe Biden. I don't know. I'm thinking out loud here, but I don't think this is really the most important thing. My instinct is that this is acutely a time because we are, 2,000 people a day in the U.S. are dying right now because of the coronavirus. This maybe is not the best time to get the most attention for what you're doing and maybe spend the political capital you've built in the most effective way. But I don't think it's the most important thing to be talking about. Could maybe Bernie get something out of this in the future? Because remember, Bernie is suspending. You can still vote for him in upcoming primaries. He will continue to accumulate delegates. And at some point in the future, we imagine, before or at the convention may be in person, it may be digital. We just don't know right now because of the virus. Maybe there is some show made out of Bernie turning over his delegates, directing his delegates, releasing his delegates, and sending them to Biden in exchange for something. That may still happen. I don't know that we need to armchair quarterback that too much. Now, let's move on to a bigger issue. What about the meaning of this for the progressive movement and the understanding of why Bernie lost, which if we don't learn anything from this, it's been a waste. If we don't learn anything from this, the same things are going to keep happening. Now, a lot of this analysis I've done before because we've already done our postmortem on the Bernie campaign. Mathematically, in the last 3 weeks, nothing changed. And Bernie accepting that the math has no path to his nomination, the math was the same 3 weeks ago. So we did most of our postmortem 3 weeks ago. I won't go crazy spending time on that, but the key points to hit, just so we're all kind of up to speed. First of all, the Democratic primary electorate is not as progressive as the internet, Reddit, Twitter progressive movement might make us think that it is. This is just a reality. We talked about this a few weeks ago. There are a lot of Democratic primary voters who just aren't participating in those online forums, so we don't see them. We come away thinking that what we see on Reddit and Twitter is far more representative of the Democratic primary electorate than it actually is. We sometimes are swayed by Bernie's large rallies. Just because people are able to gather larger rallies doesn't necessarily mean they're going to gather more voters when it actually becomes time to vote. Now, you will hear on Twitter in response to this, you're wrong, David. Everybody wants Medicare for all. Everybody wants free college. People were confused or tricked or bamboozled into voting for Biden because of these wrong calculations about electability. People are wrong. The theme online is, in the online left, it's Bernie is the guy with the popular policies, but people wrongly thought Biden was more electable, so they voted for Biden. That's not really true. And if you look at more detailed polls, it's very easy to say everybody loves Medicare for all, but somehow they voted for Biden. It's not completely true. And this is something, if we don't realize it, we're not going to fix the problems. If you look at data from the Kaiser Family Foundation, it's pretty clear. I want a disclaimer. Kaiser Family Foundation has nothing to do with Kaiser Permanente, the insurance company. Sometimes when I mention the KFF, people say, David, you're touting industry talking points. No, the Kaiser Family Foundation, you can look up, Google it. It's widely documented. It shares the word Kaiser. It has nothing to do with the insurance company, Kaiser Permanente. They are an independent research agency. And the point is, the more you tell people about Medicare for all and how it would actually work, the lower support is. Now, this doesn't mean Medicare for all is good or bad. I'm talking about the political viability. We have some of the data on the screen. This is not anything about my opinion. It is simply me reminding you the numbers are more complex than simply saying everybody loves Medicare for all, but somehow Biden won by 2.5 million votes. The more you tell people about the specifics of how Medicare for all would work, the more divided opinion is. It's not overwhelmingly against Medicare for all, but opinion about Medicare for all is split very evenly as people learn more about the specifics. So it's not overwhelming support. Number two, policy aside, not enough people liked Bernie enough to vote for him. This is not the Hillary stuff. Nobody likes Bernie. That was referring to members of Congress and the Senate. What I'm talking about is there are lots of people who I'm sure find Bernie's policies fine, but they didn't like him or his campaign enough to get them over the hump casting a ballot for Bernie Sanders. Now, there are all of these hot takes that Bernie lost because voters were confused about issues versus electability. But a lot of people just didn't like Bernie enough to vote for him. It's just the reality. Okay, I don't take it personally. It has nothing to do with the viability of the policies either. Number three, I've already talked about the toxic people around Bernie. There are lots of them. This isn't about mean people on Twitter. That's not what I'm talking about. I'm talking about campaign surrogates. It wouldn't be particularly decorous for me to start naming them. Is it decorous or decorous? For me to start naming them down now? It's over, but there are lots of people around Bernie that were repellent to many, many voters. It was a bad calculation. What can you do? Okay, we learned. And lastly, Bernie was not helped by some of the optics around his campaign. The Democratic Socialist label didn't help. I said this 5 years ago, and there are now more and more leftist folks who are coming around to this. It just didn't help. Thinking about it's not anything personal about Bernie necessarily, but the Dem socialist language, the language of revolution. Most Democrats don't want revolution. They want to fix the system. And even, this is so minor, but like when Bernie praised Cuba's literacy program and then doubled down on it, I get it. Just because Cuba did something doesn't mean that Fidel Castro is good. But it just didn't help Bernie. None of this stuff helped Bernie Sanders. Altogether, many factors. So then we get to, does this say anything about the future of the progressive movement more broadly? I think the answer is not necessarily. It depends on the choices that we make. I've said before, the movement to succeed is going to be need to be led by someone who shares Bernie's fundamental values, but has better optics, better framing, better language, and a less toxic supporting cast around them. There's plenty of time to figure that out. We don't want to take too much time because we want to make progress and win, but there's plenty of time to figure that out. But in the immediate, in the midst of a 100-year pandemic, during which the president we have is an incompetent, weaponized buffoon, we've got to deal with the general election. This is not trivial. This is not academic. And this is where the black-white hot takes are just exploding on the internet, probably to the detriment of the movement bigger picture, because everybody is claiming to have the perspective that informs what every Bernie supporter should do in November. You've got the never Biden people. You've got the Bernie or bust people, which are not necessarily the same as the never Biden people. You have the reluctant sort of Trump's better than Biden, but I hate him anyway people. Here's my suggestion. Let's stop. Let's be adults here, and I'll explain to you what I mean by that. Bernie supporters have a limited number of options. There's not an unlimited number of paths forward, and those are you vote for Biden, you vote for Trump, you don't vote at all, you write Bernie in, I'm talking in November now, you write someone else in, or you vote for a third-party candidate. These are all different actions. But in practical terms, any of these actions other than voting Biden is an action that gets Trump one vote closer to re-election. That's not a value judgment. I'm not saying it's good or bad. We'll get to the values in a moment. But any decision other than a vote for Biden is a vote or a non-vote that helps Donald Trump. Now, in blue states where Biden will win, maybe in practice, it matters less what you do in terms of helping Trump. But at the national level, all choices other than voting Biden are a vote that helps Trump get closer to re-election. Now, people may have different reasons for choosing these options. So as an example, you might be a Bernie supporter and you might choose to vote for Trump because you actually prefer Trump to Biden. Like on policy, I guess it's conceivable. You could look at the policy and you could look at everything about them, the people around them, cabinets that they would, okay. And you say, I prefer Trump to Biden. That's one reason someone might vote for Trump over Biden. You might be a Bernie supporter and you might vote for Trump because you see Trump's reelection as accelerationist compared to a Biden win. And now accelerationism is the idea that you should accelerate capitalism because it will speed up its eventual failure which will bring about the destruction of capitalism. That's an idea. You might choose any of these options other than voting Biden because you want to teach the DNC a lesson, and you see not voting for Biden as teaching the DNC a lesson that, your vote is not a blank check. So here's where I come down on this. I cannot, in good conscience, take any action that will make Trump's reelection more likely. It's very simple for me. I believe that Trump is that bad. I believe the coronavirus epidemic has been sort of the straw that broke the camel's back, or the cherry on top, or whatever metaphor you want to use, that proves beyond any doubt how weaponized Trump's ignorance and personality disorders and bad ideas and a cast of supporters and staffers are. This is not vote blue no matter who for me. I have a video about this on YouTube you can check out. I've looked at the options, and I am choosing Biden over Trump because he's better. Okay? Yesterday on Twitter, our friend Kyle Kulinski responded to journalist Mehdi Hassan's tweet about the lesser of two evils. And Kyle said, okay, white nationalist Richard Spencer versus white nationalist David Duke. Who y'all got? And I responded, half joking but half serious, I guess David Duke. He seems more frail, and his supporters aren't as good at using the internet to spread their white nationalism. The point here is I believe in harm reduction. I reject the idea that accelerationism will succeed at toppling the system. When you look at history, you see that the big progressive advances, which were, in the last 100 and so years, the 1910 to 1920 progressive era, the New Deal era, and the civil rights era, those were not revolution, break the system and build it back up, burn it down and start over. Those were advances working within the system and improving the system. Now, there is another group that is talking about, Biden needs to earn my vote. The DNC needs to earn my vote. They need to come and get me. And unless they come and get me, unless they make overtures and come and get me, they don't deserve my vote. Another debate is it Bernie who needs to convince his supporters to vote for Biden, or is it Biden who needs to convince Bernie's supporters to vote for Biden? This entire thing is childish to me. This idea of who comes and gets me specifically strikes me as both childish and completely irrelevant. I don't care about these people as people. I don't deify politicians. I've expressed before, the deification of Bernie or Tulsi or Andrew Yang or Trump. It's all cultish, and I just don't think these are people that should be deified or revered in this way. They're just people. They're just people. They are flawed people. We don't agree with everything in their platforms, period. I don't care about the cults of personality around them. I don't care about them coming to get my vote. I'm not signing a blank check. I look at policy and Biden is better. I'm not arrogant enough to say Biden's got to come get my vote. I've looked at Biden versus Trump on healthcare. Biden's better. Is Biden the best? No, Biden's better. I've looked at Biden versus Trump on taxes. Biden's better. I've looked at Biden versus Trump on selecting judges. Biden's better. I've looked at them on the environment. I've looked at them on diplomacy. I've looked at just about every issue, and Biden is better. I'm a big boy. I don't need Biden to come kowtow to me or do anything like that to get my vote. I've done the analysis on my own, and I know what the right decision is here. I'm not going to attack people who are going to go a different path than I'm going. I can only control what I do and communicate it to you, and everybody's got to make their own decisions. I'm not going to do ad hominems of people choosing a different path than me or anything like that. Trump gets another 4 years. I'll do what I can to minimize the damage. If Biden wins and defeats Donald Trump, it will be a very important victory for the United States, and it'll be an underwhelming milquetoast center-left presidency, which I will work my ass off to ensure is as progressive as possible by pushing Biden. Everybody's got to decide for themselves. Are you okay with your actions helping Trump get reelected? Maybe the answer is yes. I don't think you're a bad person. I just think you're wrong. For me, the answer is no. So I'm very confident in the action that I have to take, and it's voting for Biden over Trump. Let me know your thoughts. I'm ready. I'm on Twitter at @dpacman. We will take a break and be back right after this.
The David Pakman Show at davidpakman.com.
The David Pakman Show is member supported. Get the world famous bonus show and commercial free audio and video streams of the show by signing up at joinpakman.com.
The David Pakman Show at davidpakman.com.
Today's new members of the day are Kathleen Burns and Bradford Farrington. Kathleen and Bradford, thank you so much for your support. Means a lot, especially when I know a lot of people are having to tighten the belt. Coronavirus, we've got 16 million people over the last 3 weeks who have lost their jobs. So I really appreciate it. Also want to say thanks to Doris Bravo. Doris has been a member for almost 5 years and is today's longtime sustaining member of the day. Thank you so much, Doris. If you are looking for something to do as you are socially distancing and physically distancing and self-isolating, go to the David Pakman Show Reddit at davidpakman.com/Reddit, Reddit. Nearly 19,000 of our viewers and listeners are now participating on our subreddit. Some interesting posts I saw. User Restless Pedestrian posted an article about financiers making a lot of money off of the pandemic. I have been talking about this more so on the live streams than on the broadcast show for a couple of weeks now. There is a lot of money being made on coronavirus. You have, of course, financiers and banksters who are able now, especially, to start processing these loans under the Paycheck Protection Plan. They get 0.05% commission on every dollar processed paid by the government. You can rack up big profits doing that. You've got the short sellers of different kinds who at different points bet on the stock market declining and made money off of that. You have all sorts of different companies jumping in and making masks and other things, which of course is good. Those things are needed, but they've proven to be very profitable endeavors, including when you get a slot speaking at a coronavirus press conference like the MyPillow Trump sycophant guy, Mike Lindell, did, making some masks instead of pillows and getting invited to speak on a national stage. So there are all sorts of different people that are cashing in on coronavirus. And what we need to understand is this isn't new. Every tragedy, every calamity has people who are able to profit from it. Sometimes people are profiting by helping in a serious and sincere way. Other times people are taking advantages of loopholes or vulnerabilities, scamming people, selling things like, as you know, silver toothpaste and others claiming they kill the virus. It is nothing new that there is plenty of money to be made around tragedies, and we are seeing that happen. Another interesting discussion on the Reddit is Black Rian said we should start making a distinction between the progressive left and the populist left, pointing out that populism wants to appeal to ordinary people who feel their concerns are disregarded, whereas progressivism is a particular political philosophy supporting social reform and certain policy ideas. I want to be careful about this for two reasons. Number one, when we go crazy with how we name different groups and categorize different people, it's often not useful at all and is often a distraction. And, if you've listened to some of the pedantic phone calls I will sometimes get during live calls from people saying, I used to be a civil libertarian, but now I am a moderate ANCAP or whatever. It gets us very little. It gets us very little in actually figuring out how society, culture, and the economy should go. So here's my one thought. Populism can be left or right. Populism in and of itself can be left or right. And as this viewer is saying, we're distinguishing between the progressive left and the populist left. I actually think that populist left implies progressivism. So for me, there's not really a conflict. The populist left has elements of populism with progressive social policy, progressive economic policy, etc. I would not overly focus on these labels. Check out some of the work from the New School's Professor Federico Finkelstein, who is a fellow Argentinian. He's been a guest on the program, expert in populism, authoritarianism, etc. Let's not go crazy with the labels and the categorization. I don't think we get much out of it. Lastly, a bit of good news from the subreddit. User Bag of Squares has notified us that the pandemic has resulted in their mom becoming a fan of the David Pakman Show, pointing out that she previously was apolitical, sometimes with some anti-Obama sentiment, but that she has recently been on the online media rabbit hole. She came across the David Pakman Show and now is a regular viewer of the show. That's a good thing. That's a good thing. And I've heard a lot of those stories actually during the pandemic. A lot of people home and consuming media they wouldn't otherwise consume. And really great. Appreciate it. Say hi to your mom for me. Join the discussion at davidpakman.com/Reddit. It's free. It's something to do. And you'll see me on there. You'll see producer Pat there. Very, very exciting. We learned this morning that an additional 6.6 million people have lost jobs and filed for unemployment benefits. Now, the real numbers are actually much worse than the official numbers, and I'll explain why in a moment. You might remember that 2 weeks ago, we learned that in the prior week, 3.3 million people lost their jobs. Last week, we learned that the week before, 6.8 million people filed for unemployment. And today we learned that last week, 6.6 million more people filed for unemployment benefits. That now gets us to 16.7 million people losing their jobs and filing for unemployment benefits in just 3 weeks. Now, to understand the magnitude of this, the labor force was right around 158 million before this started. That means 10% of the labor force has filed for unemployment benefits in the last 3 weeks. Now, the question is, can we trust that number? Well, we can trust it, but the real number is much higher. Why? Well, number one, there are tons of people who lost a job but don't qualify for unemployment benefits. Not every type of job necessarily qualifies for unemployment benefits. There are people who are working under the table, as the phrase may be. There are people in certain jobs where you don't qualify for unemployment benefits. So the real number is higher. And number two, the systems for filing have been so overwhelmed that there are tons of people who have been trying to file but couldn't. Unemployment is managed at the state level. Like we have the department in the Massachusetts Department of Employment that manages Massachusetts unemployment. The websites are often not up to the task of handling the increased traffic. The phone systems are often collapsing. So there are lots of people who have been trying to file but haven't been able to. So in early May, the April unemployment report is going to be released, and it could conceivably hit 15% unemployment, which would be historically high. I mean, you have to go back to the Great Depression era where you had, 25% in 1933. We've not seen numbers like that, 15, maybe even we could get to 20% since. These are tragic numbers. It's going to take a long time to recover, regardless of Trump saying it's going to go up like a rocket and we're going to be reinstating everything very quickly. A lot of jobs are not going to be reinstated as the economy starts to open back up. Many restaurants and other businesses are not coming back. They are closed for good. It's going to be a long process. Many people will be starting essentially from scratch looking for new jobs. Now, a few reminders. Here is Donald Trump's Commerce Secretary, Wilbur Ross, saying just weeks ago that coronavirus will be good for the economy while giving us a hacking cough as he says it. Take a look.
I don't want to talk about a victory lap over a very unfortunate, very malignant disease. But the fact is, it does give businesses yet another thing to consider when they go through their review of their supply chain. On top of all the other things, because you had SARS, you have the African swine virus there, now you have this. It's another risk factor that people need to take into account. So I think it will help to accelerate the return of jobs to North America, some to U.S., probably some to Mexico.
So we can add that to the montage of really clueless people who have no idea what they're talking about. Now, in the meantime, and we're going to talk about this in the interview segment today, people still haven't gotten their $1,200 stimulus checks. From reports I'm seeing, the unemployment supplement from the federal government of up to $600 a week still hasn't started in many, if not almost all of the states that are through which people are receiving unemployment benefits, not to a significant degree. despite Trump's claims during his press conferences that billions and billions of dollars in the Paycheck Protection Plan funds have been doled out already, it seems that very few businesses have actually received any money so far. We're months into this thing now. And where are those benefits? Where is the money? These are very ugly numbers. They are made worse by the fact that the Trump administration has been so brutally behind on all of this. So we need a government that can actually behave responsibly and react quickly. We don't have it right now.
The David Pakman Show at davidpakman.com. Welcome back to the David Pakman Show.
It's great to welcome to the program today Jason Goldwater, who's a California attorney who represents small and medium-sized businesses throughout Southern California, advises businesses on employment and labor issues and best practices. Jason, great to have you on today.
Thanks, David. Great to be here.
So let's start with, in figuring out, every day we hear this number of billions of dollars is going out. Everybody's getting $1,200. Unemployment's being boosted by $600. The Paycheck Protection Plan, billions and billions and billions of dollars are going out. Let's start talking through what's been announced and what has happened. So the $1,200, we're close to 2 out of the 3 weeks that they said it would take for that money to start going out. Is there any system yet for people who did not get direct deposit of their tax returns last year to say, here's how you get me my money? Are any of these infrastructures in place at this point?
So they are not. The IRS has said that they are going to create a portal on their website where people can essentially go on and say, I want my money going to this bank account or going to this address. So that has not happened yet, even though the private sector could probably do this in under a day. The IRS, I'd be very surprised if they managed to do it by next week. And don't forget, it's not just people who didn't receive direct deposit, but maybe people whose bank account information has changed, whose addresses have changed. So none of that infrastructure is in place. And like I said, I'd be very surprised if that happens by next week. I think probably 1 to 2 months is more likely.
So 2 weeks ago, they said in 3 weeks, the people who have the same direct deposit information as when they filed their tax returns would start getting their $1,200. The people who need to, as you say, provide banking information, might have had a change of address, et cetera, it could be 3 more weeks. That sounds like you're saying it's all a little bit optimistic right now.
Well, right. I mean, unless the IRS is going to start blindly sending out $1,200 to bank accounts that, just because something was correct on a 2018 tax return doesn't mean that bank account is still in effect, could be closed. I mean, they could be sending $1,200 really to a bank account that's not open, to someone else's bank account. So I don't see how this is going to happen unless people first have a chance to confirm that the information the IRS has is still correct. From the information the IRS had potentially a year and a half ago.
Okay, so now let's talk about the supplemented, the bolstered, boosted unemployment. The idea was unemployment is, of course, managed at the state level. Massachusetts has its system. Illinois has its system, et cetera. There are different state level benefits that are the maximum benefits available to people. The federal government announced they would be supplementing those benefits with up to $600 per week in additional funding. Now, I know a lot of people who have been, who filed for unemployment in the last 3 weeks, as 16 million people did. They, as of now, are not getting anything additional above and beyond what the state provides. What do we know about the rollout of that?
So, as you just mentioned, everything is occurring on a state-by-state basis. All I can tell you is there's very little information actually about what is happening. We know that there is supposed to be this additional $600. We don't know when it's going to be implemented. As you mentioned, each state has a different system, and on top of that, the CARES Act also provided that people who were self-employed, independent contractors, for example, gig economy workers, would also be eligible for unemployment assistance. Now, typically, if someone is self-employed or an independent contractor, there's typically a voluntary unemployment insurance program that they can pay into to be eligible. So the CARES Act does away with that, But the problem is there is not a single state yet, as far as I'm aware, that has implemented guidance as to how exactly this program will work for people in the gig economy, for example, people who are self-employed, and who is eligible and how they're going to get their money. Right now, the guidance essentially is for people to go ahead and apply, and they'll try to figure it out later. Of course, it is important for people to get applications in because the applications will be processed in the order that they're received, and they will not get the unemployment insurance until essentially for a period before they applied.
So I know some people in the Midwest who, there's a lot of states in the Midwest that have, they don't have very robust unemployment systems. So they are maxing out sometimes at $350 a week. They're counting on that extra $600 that the federal government says is coming, and it's not there, and they're not getting any answers from the state unemployment departments as to when that's going to start.
Yeah, I mean, California, I can tell you, maxes out at $450 per week. So you can just think with our cost of living in San Francisco and Los Angeles and San Diego, $450 a week does not go very far at all. You're absolutely right that the additional $600 is absolutely critical. But the state employment offices are used to processing a certain number of applications per week. And as you've pointed out, we've had an additional 15, 16 million people applying for unemployment, and the infrastructure is just not there to process those kinds of numbers.
So let's now, oh, sorry, go ahead. Yeah, go ahead, Jason.
There is one thing I wanted to mention that a lot of people are not aware of. So this varies state by state, but a lot of people who are underemployed right now, who have had their hours cut, may be eligible for unemployment assistance. Again, depending on the state, depending on what their earning level is currently. So it's important for people who are underemployed, who've had their hours cut, to go ahead and apply for unemployment insurance as well.
So then we've got the programs for businesses, and part of this is the payment protection plan. There's a couple of other programs and elements to these programs that are available. Every day, I'm sorry, what was that?
Elements of medical.
Elements of medical, yes, elements of funding. So every day at a press briefing, Mike Pence or Donald Trump will say something like, 1 million people have applied, or 3,000 lenders are now taking applications, or we have processed $10 billion. Every day it's different, and the terminology being used is different. Are businesses actually getting money yet? Have businesses received any money yet under that program?
So I am not aware personally of any businesses that have received money under the Paycheck Protection Program or the Economic Injury Disaster Loan Program. So That doesn't mean it hasn't happened. It just means that the rollout has not been very widespread. There are still some banks like Citibank, which is my bank, that are not even accepting applications. And the money is already going to run out. Bank of America on its own, I think, as of a few days ago, they processed, I think, over 20% of the total funding available for the PPP program. Meanwhile, Citibank is not even accepting applications. So the whole again, the rollout here has been, unfortunately, a little bungled.
It's increasingly seeming to me, and I hope that things can get reopened sooner than later, as is safe. Never beyond what is safe, but I hope things get going as soon as safe. It's starting to seem like a lot of these funds may not even get to people before the reopening starts if things continue on this path.
Yeah, it's not just a question of reopening, but by the time we're through with the lockdown, frankly, there will be so much job loss. And unfortunately, the job loss really is not just affecting at this point the hospitality industries or the restaurant industries or economic industries, but it's affecting all the other industries indirectly. I can tell you as a lawyer, for example, the courts are closed. So any lawyers who are in litigation have no work right now. Even if they did, businesses don't really want to be spending money on lawyers. This is affecting every segment of society right now.
In the last bit of time we have, is there anything we have not talked about, either in terms of programs or in terms of what individuals can or should be doing that you think is important for people to know?
So I did want to talk briefly about the programs that are available because there have been some changes to the program since they were initially announced. So the first program that's available is the Economic Injury Disaster Loan Grant. So the bill said, and the Small Business Administration initially said that these were going to be $10,000 grants. So the SBA has now changed that. Now it's going to be a $1,000 grant per employee that the business employs up to $10,000. So you can imagine a lot of small businesses may only be getting $1,000 or $2,000, for example. Those loans were supposed to be processed in 3 days. I don't know of any. I mean, the application has been up probably for a week and a half or 2 weeks, and I don't know anyone who's gotten that.
Yeah.
You can apply directly for that on the SBA website if you Google SBA COVID-19. The second part of that is the Paycheck Protection Plan. So that provides up to 2.5 months of payroll, and it's a loan at 1% now. Initially, it was 0.5%. Now it's 1%, but the loan can be forgiven if 75% or more of the proceeds of the loan are spent on payroll and your payroll does not decrease. And individual banks are the ones processing those applications. And then the third component are just ordinary Small Business Administration loans. They're called 7A loans. And for new loans that are issued, the Small Business Administration has pledged to pay 6 months of principal and interest on those loans.
So
and again,
essentially, you could get a loan that might be a 2-year loan, and in the first 6 months, those payments would be made for you, and you would not need to make that up.
Correct. So theoretically, you could pay the principal back after 6 months minus the principal payments that have already been made on your behalf, and you would not end up owing any money at all.
And of course, this is if you can actually get the money dispersed, which seems to be a question mark around all of these programs right now.
Yeah, I mean, I'll tell you that the ordinary SBA loans are a little easier to get just because banks make more money on that. The interest rates are substantially higher than the PPP loans. And so banks, although the difference with the 7A loans is that the banks do assume some risk on that, usually from 25 to 50% or so. So banks may be more reluctant and probably will be more reluctant to issue those loans right now.
We will continue keeping an eye on it. And of course, as important as the small business programs, the individual programs, unemployment, and the $1,200 deposits, which we are continuing to try to erase the question marks around, but question marks certainly remain. Jason Goldwater is a California attorney. Jason, thanks so much for talking to us and explaining all of these different elements.
Thank you, David. Best of luck to you.
The David Pakman Show at davidpakman.com. The David Pakman Show at davidpakman.com.
Hey, this is pretty interesting from a Joe Rogan episode earlier this week. Now, I know that a lot of people want to talk about Joe Rogan saying he'd vote for Trump over Biden. That's a different story. That's not today's topic. I hope to be able to talk to Joe personally about the Trump-Biden thing soon. But for today, I want to play some clips for you of Republican Congressman Dan Crenshaw on Joe Rogan's program earlier this week. And in the context of coronavirus, they got to talking about healthcare. And Dan Crenshaw rolled out just about every bad argument about healthcare. And what I really like about this is how Joe Rogan ended up kind of de facto destroying the arguments that Dan Crenshaw was making, but in a way that was just completely genuine. It wasn't calculated with talking points. And what I mean by that is Joe Rogan is more of a political hobbyist than a political analyst. And he even said recently, when I say I think I'd vote Trump over Biden, I don't know what I'm talking about. And he actually said, go, listen to people. He actually listed the David Pakman Show. Go listen to people who really are doing this full time. He doesn't consider himself a political expert. I dub it more of a political hobbyist. And Joe has said many times, politics is not his main thing. He's interested in it. He has opinions. He talks to people, but he's not a politics guy. So what's interesting to me about the clips that I'm going to play for you is that Dan Crenshaw is making bad argument after bad argument, arguments that have a lot of history. in different political circles as being the types of talking points you want to use. And Joe dismantles them not by trotting out his own crafted talking points, but just by kind of reacting in real time with common sense to the nonsense that Dan Crenshaw was saying. So let's get right into it. I think you'll find this interesting. First, here is Dan Crenshaw trotting out a popular argument from libertarians, including people like Rand Paul, which says Medicare for all or single payer reduces freedom and it sort of enslaves doctors. They argue we're not free with Medicare for all. And Joe Rogan makes pretty quick work of it. And you'll see Dan Crenshaw become visibly confused and sort of start jumping around with non sequiturs, trying to retort, but failing.
When we talk about Medicare for all, it tries to move past these essential foundations, whether of a free society that we have to adhere to. And because the other thing I push back on a little bit is the healthcare as a right statement. And I push back against that because when you're calling something a right, what you're effectively saying is that somebody else has a obligation to serve you. And it's hard to call something a right when that right requires the service of somebody else.
But don't we already do that?
Nitpicky.
Don't we already do that with the firemen? Don't we do that with the police department? Don't we do that with public schools?
Not exactly. No, I mean we have public services that I would distinguish those public services from something like a direct point of care, and I would distinguish them to an enormous extent. Like, and here's why: you can add a few 100,000 more people to the nation's population, and it doesn't change the mission of the military, right? Like it doesn't take anything away from them. But because of this sort of non-rival, this is like an economics term, but this sort of non-rival attribute of these things, it is different, right? Because there's only a select number of doctors. And we've already said that once you put price controls in, there's going to be less doctors because doctors will be paid less. They'll get burned out more. Then hospitals will be able to, I actually never finished that point.
So Dan tries to slip in, this is an economic term, implying, a lot of people don't know this term. But this is an old libertarian argument. That's a really bad argument. So here's the deal. Single payer doesn't make doctors slaves and it doesn't take away freedom. In fact, we already have the Emergency Medical Treatment and Active Labor Act, which mandates that hospitals must provide stabilizing emergency treatment to patients in a dire emergency situation or delivery services to a woman who is in active labor, period, no matter whether they can pay or not, no matter whether they have insurance. If you're an ER doctor and someone comes in with an emergency, you must give them stabilizing treatment. This has been around 34 years, since 1986. Back then, you had some people saying you're enslaving doctors, but you're not, and it's a bad argument. Consider lawyers. Everyone has a right to an attorney, even if you can't afford one. You have a right to an attorney. Are attorneys slaves? Are attorneys enslaved by that? No. Now, does any one lawyer have to take a certain case? No, typically not. Does any one doctor have to treat a specific patient under single payer? No more than the general responsibility to the Hippocratic Oath and to provide emergency stabilizing treatment, which dates back 34 years. Bad argument. Let's continue.
The reason price controls reduce supply and the reason we see supply reductions in other countries is because, well, hospitals don't get the same amount of money. They're not going to invest in that extra ICU bed. They're not going to buy those extra ventilators. They're not going to hire those other doctors. A doctor doesn't want to be a doctor because they don't make the amount of money that they thought they would make. They're doing extra work because there's more people who now have access to them, but there's less of them. So wait lines are huge, and they're seeing multiple more patients a day. Doctor burnout increases quite a bit. That's the quick answer as to why that happens. But does that kind of answer your question?
Now, here I really need you to understand, this is a Gish Gallop. Dan Crenshaw is throwing about 4 to 5 different arguments at Joe Rogan. None of them make sense. None of them are actually arguments against single payer. And now he's moved beyond single payer and is starting to talk about reimbursement rates, doctor compensation. That's one issue. Many countries have successful systems, but they've got to figure out doctor compensation. That's just one issue. Then Dan Crenshaw throws single payer will increase demand and every hospital is going to be full. That's an old, tired argument. When you give everyone health care, it doesn't increase demand in total. It shifts demand from people using emergency rooms and waiting until things are more serious to people going and getting checked out earlier, going to their pre-CP instead of the ER. And that actually can, in many ways, lighten the load on emergency rooms and emergency care and reduces the serious conditions because people get checked out earlier. So Dan Crenshaw here makes so many different arguments in 30 seconds that it's hard to keep up. Now let's skip forward to Joe reacting to this.
This is getting really
that does
deep on this.
Yeah, the human right issue. We kind of moved around with that. The idea that it's different than the fire department or the police department or
well, it's not a right either. Actually, the fire department's not necessarily a right as we would.
But it's a public service that's provided to everyone.
Yeah. It is, but understand. So let's call it a public service then, and let's call doctor healthcare a public service as well. If we were to do Medicare for all,
but wouldn't the result be the same if it's provided for everyone?
Not from a practical standpoint, just because it's much easier. Again, you could add 100,000 people more to your city, and the fire department would have marginally more work to do.
Dan Crenshaw says, not from a practical standpoint, but actually, yes, Joe is right. It would be the same thing from a practical standpoint. It would be different from an ideological standpoint where, you know, Dan Crenshaw's ideology makes healthcare different than being a firefighter. But in practical terms, it is basically the same thing as Joe Rogan points out. Let's skip ahead a little now. And this is just bad from Dan Crenshaw. And Dan does something slippery. Dan starts talking about socialism as a system more broadly rather than just talking about healthcare. Joe's talking about healthcare. And then this is just amazing. Remember how in the clip I played for you, Joe Rogan was saying healthcare for everyone as a public service or a right or whatever you call it. It's like firefighting. It's like police or public education or whatever. And back 5 minutes earlier, Dan Crenshaw argued, no, healthcare is different. Now, in this clip, only a few minutes have gone by, and Crenshaw says, no, Medicare for all isn't socialism. It's a public good. That's right, Dan. That's what Joe said 5 or 6 minutes earlier when you said, no, it's different. Take a look.
Right, but we're talking about well, you're talking about socialism overall, not just just involving medicine. You're talking about socialism in general, and I'm saying, isn't the fire department an example of socialism that works?
Well, it's definitely not an example of socialism. I think it's an example of a public good, the way the military is an example of a public good, the way the highways are examples of public goods, the way parks are examples of public goods.
Right, but they're funded by the people. It's funded by people overall, and it doesn't cost people money to use them, and the people have these as a basic part of our society and our civilization.
Dan Crenshaw is just a human pretzel here. He's completely wound up into knots. When Joe says it's a public good like these others, Crenshaw says, no, it's different. 5 minutes later, when Rogan says, aren't we socializing an element of the economy and an element of society that works fine to socialize? Crenshaw says, no, it's not socialism. It's merely a public good. Well, okay, why didn't you agree with Joe when he said that 5 minutes earlier? Here's Crenshaw's last reaction. And Crenshaw, he basically white flags and he plays these pedantic semantic games and says in the end, these are really just semantic issues.
No, I understand that, and I have no problem with that. I just would not call them socialists.
Well, what would you call the fire department? How does it get funded?
It's a public good.
How does it get funded?
It's a public good. It's funded by the public,
right? And
it's not relying on it's not relying on the tenets of socialism to function. And now we're kind of having a discussion of definitions, and this is an important discussion to have because oftentimes even Democrats aren't really talking about socialism.
Well, even Bernie Sanders doesn't call it socialism. He's talking about democratic socialism, and he makes some very clear distinctions between the two of them, which I think you could apply to things like the fire department or the police department.
Yeah, there's a lot in that.
So there's a lot there, and I'm not going to subject you to more of this, but I like this for a few different reasons. Number one, they try to stake ideological claims when they can. But when Joe Rogan breaks down those claims with simple questions, they retreat to semantic games and gish galloping, which is just throwing out so many different assertions that it becomes very difficult to keep track of them and actually refute them one by one. That's a sign that the facts aren't on your side. But number two, you all know I've been critical of some elements of Medicare for All plans. There are issues around cost estimates and other issues with a lot of these plans. I would actually love it if the left and right could simply agree on what we know, which is Medicare for All will increase access and Medicare for All can maintain or increase quality. The question is, at what cost will we be able to maintain quality and increase access to 100%? The coronavirus stimulus has proven when we want to, we can find 2 trillion, we can find 6 trillion, we can find 10 trillion if we want to. The money is there if we decide we are going to do it. I would much rather be able to move past these childish arguments that Dan Crenshaw is laying out, which Joe Rogan exposes as really very bad arguments. Let's get our hands dirty and do the nitty gritty work of figuring out how this can all work, because it can work. It's a question of at what cost and how to best optimize it. I've been keeping things light in the voicemail segment at 219-2-DAVID-P. We're continuing that today. Take a listen.
Hey, what's up with it? Just wanted to know your opinion on peanut butter and jelly sandwiches.
Right.
If you thought they were good, or if you thought maybe they weren't that good.
Yep.
Thank you.
Beautiful question. Now, here's an interesting thing. Because I moved to the U.S. from Argentina, peanut butter and jelly is not a thing in Argentina. So growing up, my parents had no idea about PB&J. They would pack my lunches, and so many people in elementary school had PB&J. I had no clue what it was. Eventually, I was introduced to PB&J, and I like it, with the caveats that I don't want crunchy peanut butter. I want smooth peanut butter, and only certain jellies, marmalades, and jams make sense. Orange marmalade in a PB&J, no, absolutely not. Grape jelly, raspberry preserves, now we're talking, my friends, and a lot of coronavirus PB&J, I think, is happening. Join me on the bonus show today. We've got a lot to discuss. Pat will join me. We will be back with a new show tomorrow if you are not privy to the bonus show.
The David Pakman Show at davidpakman.com.
Special meeting of the Brattleboro Select Board Thursday, April 2nd, 2020. Have we confirmed that the meeting has been officially warned, Peter?
It has. Thank you.
Thank you. So welcome to this strange and difficult time we are all in. And this strange, and we'll get used to this method of meeting, I think, in the next few weeks. And I hope everybody is well, and I hope everyone's haircuts are holding out for the time being. So I'd like to start us off with new business, and our one main new business is going to be a discussion of COVID-19 and its effects specifically to Brattleboro, and steps we've been taking and potential steps we could take. So I'm going to turn things over to our town manager, Peter Elwell, and to go ahead and ask you to give us a little bit of an update concerning town operations.
Sure. Thank you, Tim. I'm going to focus mainly on the period since March 24th, because that is when the governor issued the stay home, stay safe order. And that the operation of town government between the last sort of live update like this, as opposed to the daily updates that are being posted on the website, the operations between March 17th, when that last live update happened at a select board meeting that evening, until a week later on March 24th, the operations were not fully normal for sure, but continued in much the same manner as we had been in our adjusted operations through the middle of March. On March 24th, of course, things changed very significantly, both for town government and everyone else, in terms of the necessity to stay at home as much as possible, and for many people to be doing that virtually full time. And so town government also had to adjust operations significantly. We went from not just having the facilities closed, but actually to not performing our usual work in those facilities. And so a quick summary of where we stand, where we powered down to over the next couple of days after March 24th has been pretty stable since then, with slight adjustments. The adjustments have been almost entirely in field work, as we have come to better understand what can be done safely and what needs to be done in order to protect the public. And so I'll speak to that in a minute, but I'd like to just quickly summarize sort of how the different services that we provide and different administrative support services are in fact functional now, the degrees to which each one is functional. So above all else, emergency services are being provided 24/7 as ever, with some modified procedures. So there are some ways in which fire and rescue crews arriving at the scene of a medical call are addressing, there's procedures they're following that are specific to COVID-19 precautions, but they are still responding to any call for assistance that comes in. Likewise, the police department is receiving all calls in the normal manner through the dispatch center. There is an adjustment in how the police department is responding to those calls. If there is anything life-threatening in the nature of the incident that has brought the call, then the police are responding as normal. If it is not a life-threatening situation or a harm-threatening situation, not a situation where someone's safety is of immediate concern, then the police department is following up on that through communications other than dispatching a police officer directly to that scene. And those decisions are being made on a case-by-case basis by the officers who are in charge of each shift as they receive those calls that are of a less emergency nature. And if one thing I should say about that, and it applies to everything that I'm summarizing, and as we go through discussion this evening, if there's ever a time where the amount of detail that I'm able to share is less than what you're seeking, all of the department heads are in this meeting and can be called upon to provide additional detail. So for instance, if you wanted to hear from Chief Fitzgerald about how those determinations are being made, about how to follow up on a call that doesn't need an urgent emergency response, then he'd be able to address that.
Thank you, Peter.
The one other type of sort of essential 24/7 service, so we often think of it in terms of the public safety operations. We often take for granted the public utilities operations of water and sewer, but they are similar in nature in that the community depends on them literally just for basic functioning, and so we have to take particular precautions to keep the employees who are operating those facilities safe, and to make sure that the facilities stay continuously operational in a safe manner. We're doing that, and so while there are special procedures in place both for the water and the sewer operation, for those of us when we're opening our taps or flushing our toilets, you should see no change at all from normal life. To administrative operations and non-emergency operations. On the administrative side and the ways that the public communicates with town government, while it is awkward and a little disconcerting to not be able to interact directly and face-to-face in town facilities and out in the community, we are still available, fully available in the administrative contacts that people often have with us. Email is fully functional, and we're spending a lot of time on it, communicating with folks. I would urge people to use our email as a way of staying in touch. And also all the normal telephone numbers at which people receive or reach out to us, usually in all the different administrative functions of town government, are working. And they're working in the normal manner. We forwarded all of the direct dial lines so that the person who you would normally reach on that direct dial line, you can still reach directly by calling it. Doesn't mean you won't ever get a voicemail, just like in normal business, you might sometimes get a voicemail, but the person that you're trying to reach is the person you will either reach directly or reach through your voicemail so that they can get promptly back to you. The direct dial numbers, we intended to do the same thing with, the numbers that are the main number for each office, and we learned that our telephone system just won't accommodate that. So instead, those numbers are receiving messages, and employees are checking them regularly throughout the day to pick up any messages that are left on the main office numbers. Moving to field operations, and I would say one other thing about the administrative operations. So in terms of the ability for folks to stay busy and productive and doing the work of town government, there is a significant degree to which employees are doing, completing the normal tasks that are part of daily operations, even from our many remote locations. So working from home, a lot of the administrative work of town government can continue really as it would if we were in our offices, just our communication methods are different. To the degree that some departments are less able to continue conducting all of the normal business they would conduct, we have repurposed some employees, and we have other employees who are working on projects that are specific to their department, that are part of sort of a longer term perspective, things that maybe there had not been time to get to, or things that otherwise would be beneficial to town operations when we gear back up to full and normal service. And so there is a significant degree to which town government work is just continuing, but in this unusual way. There are some employees who are less than working at less than full capacity, and there are very few employees, but there are a few in specific town functions that are no longer operating, who are actually at home and not working. But out of our 140 or so members of the team, there are fewer than 10 in the status of at home and not working. The field operations, I'll just remind everyone something that's obvious and doesn't any longer seem very important because life has changed so much, but back on the 17th when you met, we announced that parking enforcement had been discontinued indefinitely. That was an important early action that we could take and did take. It continues and will continue. Parking enforcement will continue to be suspended until we resume any kind of normal operations. And then the field activities of Public Works and the Parks Maintenance team are something that's an important factor here. In our initial powering down, when we got the governor's order, in that first day or two at the end of last week, we more fully brought those crews off the street as well. And we're initially responding in an on-call manner. We quickly realized that it was going to be important for public safety out in the community, and that it was going to be important for public safety that we continue some level of service delivery from the field crews of Public Works and Parks Maintenance, and that we could perform that work in a manner that was safe both for the employees and for society. And so each unit has made adjustments as we went into the weekend and then during the course of this week in order to be able to continue to keep the transportation system functioning safely, in order to make sure that green spaces in the parks are available for public use, and otherwise just performing work where the vast majority of the work being done by those units is being done by individual employees with a piece of equipment and a single person, so there's not social interaction going on, but the work is being performed. And then there are rare occasions when more than one employee is teaming up on something when it's necessary for them to do that for their own safety and in order to perform a task that maintains public safety. So our adjustment of that has meant that we still have employees that are on call. We're not bringing in whole shifts of people in the normal manner, but all of the employees are staying busy, and the work is getting done that needs to get done for maintaining the safety of the community. And the reserve employees on any given day are available on call at any time to come out for an emergency. And we know that we could have a water main break, we could have some other kind of significant issue arise where we actually have to bring sort of a normal crew of people out that might involve 4 people or 6 people working together in order to solve something, and we will do that as needed as emergencies may arise. The parks side, where they're working individually in order to keep the green spaces safe, I want to stress that we can't keep the equipment safe. So the basketball courts should not be used. The playground equipment should not be used. Even park benches should not be used. But we want to encourage the public to come out and use the green spaces in this time when life is so stressful and we are for so much of our days confined indoors. It's important for people to get exercise and get some fresh air, and the town can help in that by having the green spaces maintained in a safe manner. So whether that's a park space where you can go to the park but not use the equipment, whether it's the Bratt Common where folks can come and enjoy the open space, we want people to come out and use those facilities, and we want to assure you that as long as you don't use the equipment while you're there, we are keeping those spaces safe for public use.
Peter?
Yes.
Could I just ask a question related to what you just spoke about?
Please.
I'm just curious because I haven't been able to get out much. I'm curious if the equipment is marked and how you've done so,
Yes.
And maybe Carol can chime in or however you'd like to handle that.
Sure, thank you. So yes, at the playgrounds especially, and Carol can jump in if there's a broader, more complete answer she'd like to provide, but at the playgrounds, we were quick to put out signs that said, please don't use the equipment. We're not able to keep it sanitized. We were especially concerned about that because of the likelihood that, with schools closed and kids needing to work off some energy, that parents would want to come and use the playground equipment. And there's just no way for us to ensure that it stays clean enough for that to be safe. In fact, it's almost certain that it wouldn't stay clean enough for it to be safe. So we've simply said, stay off of it.
Thank you.
So forgive me for this. I want to just mention one thing about how we are learning from using GoToMeeting. I'm realizing that I have this odd sort of dim spotlight effect going on. I pulled a blind in where I am in my house in order to not have glare, and I've turned out instead to be sort of hiding in the shadows. So I'll address that for next time.
It's dramatic. Yeah, it's got a little bit of a underworld boss, crime boss thing going on.
Yeah, something I never really imagined I would ever project, but thank you. Anyway, I'll address that.
I think we're all figuring.
Couple of last things that I'd like to share, and then staff is happy to shed any additional detailed light you might want us to, and certainly to participate in discussions about how things are going and what more can be done. But I do want to stress that the two enrichment departments, the Brooks Memorial Library and the Recreation Department, both are staying, investing a lot of creative energy in trying to stay in service to the community during this time when the way they usually are is impossible. And so even though we've got all the recreation programming canceled, there are ways in which the Recreation Department is working online and communicating with their program participants, looking ahead to the time when we can gear back up, but even to keep people entertained and engaged during this time as well. The most recent example of that just announced today is a virtual Easter egg hunt that folks can go online and get more information about at the Recreation Department's website. That'll hopefully be fun for children and families. And the library, because it does a lot of online programming already as part of normal services, is actually able to provide quite a lot of service and quite a lot of access to resources, even though we're not able to have people come to the library to access physical resources in this time. So I'd urge people to use both websites and stay in touch with the library staff and the recreation staff about the services that they are providing. A reminder about a couple of things that are normal. Very little is normal these days, but if you're going to have an outside fire, you need to obtain a burn permit from the fire department. That's an important thing at this time of year. We have a lot of people cleaning up yards and burning off the collected leaves and stuff, and an open air fire requires a burn permit. So please be sure to contact the fire department to get one. And the annual leaf pickup, spring leaf pickup, is going to happen on Friday, April 17th and Friday, May 1st. The hardware stores and agricultural supply stores remain available, so you can buy the brown leaf bags in those locations, fill them up, bring them out to the curb, and they'll be picked up on Friday the 17th, townwide, Friday the 17th of April, Friday the 1st of May. That again is an activity that we're really encouraging people. If you're someone with a yard to take care of, take advantage of that one tiny bit of normalcy and to get some exercise as well as to clean up your yard, and you'll receive the normal curbside pickup of those leaves that happens at this time of year. We have been asked by many people in the community about suspending pay-as-you-throw, and the answer may feel a little bureaucratic to people. I'm sorry if it does, but it's we have asked the state of Vermont for permission to stop. Whether it would be possible for the board to make a decision to suspend pay-as-you-throw temporarily, and the answer we got from the state is no. And the reason, the explanation I think people need to understand about that, because it seems kind of crazy, like why can't we just do that? It's a local program. Why wouldn't we decide it locally? Is because the state law related to solid waste collection and disposal requires what they call variable rate pricing, so that the more someone throws away, the more they pay for the collection and disposal of that garbage. It's intended in normal times and has been very successful in normal times in diverting what would have been garbage in years past into the recycling waste stream and the compost waste stream. Better, more sustainable, just a proper way to run that part of public service in normal times. The because the state law requires variable rate pricing, and because the sale of the purple and yellow bags is the way that Brattleboro complies with that state requirement, we need the state's permission if we're going to suspend pay-as-you-throw and therefore suspend variable rate pricing. Randy?
Let me get unmuted. I do want to just respond to our community members that asked about this, and just from the heart say that I am disappointed in this decision from the state. I feel like this is a time where we need to be able to be responsive and to be pulling as much burden off of humans that are in our community as possible. And I feel like this is a burden that we could have been able to pull back on. And my heart is with myself and our entire community in the fact that we aren't able to do this. I'm disappointed in the decision.
Thanks, Brandy.
And the last thing I wanted to mention is just one thing that also has been news out in the community, but just in case anybody had not heard who might be affected by this, and to make sure that it's the reminders out there, the select board on March 17th took an action that indefinitely deferred the obligation for small businesses who have loans from our small business assistance program to pay those loans back. So there's usually monthly payments required. Those are suspended until further notice, until we get far enough along that we not only are getting out on the other side of COVID, but also able to assess what other supports the business community needs in recovering from the economic impacts of COVID-19. And there'll be a time in the future when the board will make a determination it's appropriate to resume the requirement of those monthly payments. But in the meantime, each month that goes by when those businesses are not making a payment on those loans will simply be added to the far side of the end of the loan period for repayment, subject to any future action that the board may take otherwise regarding those loans. But as of right now, the most important news is that it was an action you took quickly, recognizing that businesses are being immediately and significantly impacted by this, to say that those who had relied on this assistance from the town as far as either starting or expanding their businesses here in Brattleboro would be free of the obligation to pay those loans back for the foreseeable future.
Thank you, Peter. Yeah, I know it can be a pretty significant thing. A couple of loan recipients have thanked me for that. And if only we could all have our mortgage companies do that for us as well. I know it's something I'm working on.
That's my report. I'm happy to assist in your discussion, or any of the department heads can chime in if you need more details.
Okay, thank you. I did want to just say two things. This is a special meeting, so it doesn't always follow the exact protocol of regular meetings. But I did want to open it up to our 5 board members with just a platform right now in case you wanted to address anything, have additional questions, or just make a comment about the state of the times, just because it didn't appear on the agenda. And then also wanted to point out that I did have a conversation with our ESL interpreter and pretty much promised that it would only go to about an hour because Elizabeth is here on her own right now. But I think a lot of the discussions that we're going to have will be continuing to roll over to next Tuesday, which is not far away. So feel free to, I'll try to keep us tidy with the time if the questions get fast and furious. But having said that, any other board members want to say a couple words or have a question? Oh, Brandy.
I'm still figuring out the mute, unmute. So I wanted to piggyback on we had talked about some of the things that the library was able to do for the community. And I wanted to give some accolades to the Brattleboro Police Department for this fun thing that they're doing for the kids, where I think Officer Stanley's been out doing some scavenger hunts and seeking things. And I know that I'm trying to find ways to bring normalcy into my kid's life, and having that connection there has been really good. And I have a lot of more serious things to say about things that I want to see done during this time. But at this very second, I actually just want to give a shout out to the police department for such a thoughtful and creative way to engage our kiddos who do not, as much as we don't know what's going on, they've just been dragged and plunked into the middle of this. And I'm really appreciative to the police department for that.
Thank you, Brandy. Anyone else? I think I had a very quick follow-up question, if you don't mind, Peter, because it occurred to me with the burn permits, maybe Mike could chime in. I'm curious if it doesn't apply to those fairly small contained units that people have on legs, you know? Can you just clarify that? Because, you know, if people want to go out back and have a small burn, does it apply to small, you know, under 3 foot units?
Mike is on the screen, and he's the fellow who's going to need to answer this one.
This is awesome. Yes.
How's that?
Chief Bukowski. Did you hear my question?
Hi, everybody. So, Tim, what we do ask is, even if it's a contained fire in those fire pits, that they at least call the station and let us know, because a lot of times we'll get a report for a column of smoke, and those burn permits get plotted on a map, so we can, even though we'll check them, at least we got a good idea where they are. So we do ask people to get a burn permit whenever they want to burn something.
Great, thank you.
You're welcome.
And so it sounds like that's it for the update and board members' comments. So our only other...
Ken, excuse me for interrupting.
Oh, yeah?
Liz, trying to get your attention.
Sorry.
Patrick, maybe we can unmute the select board members so that
I
they
just
can
had
chime in.
a question about Public Works. Will this spring street cleaning occur?
Yes, the street sweeping.
Yes.
Oh, it's occurring very loudly.
Oh,
Yeah, I think
well, I haven't
Thanks
seen
for
it, but I
asking.
have seen a lot of debris on the streets.
Right, and I really appreciate you asking that. I meant to mention that in my summary. That's exactly the kind of activity that is ideal for this unusual moment in time, because the single operator can, you know, come into work in their own vehicle, get into the sweeper, do the work that is, you know, beneficial to safety and cleanliness in the community, go back, sanitize the sweeper, get in their car and go home. And so it's not creating any additional risk for the person or for the community. And it's an important task at this time of year. And I see Steve has come on. Do you have something you want to add to that?
Yeah, Peter, I think you covered it quite well. We've also been doing the parking lots downtown. You know, we've seen some glass, broken glass, there's dog debris. So we're trying to keep the streets clean. Those are done on weekends. And then throughout the week, the sweeper has been actively out they'll end up doing all the streets in town.
Thanks, Steve. I just realized the great thing about this is that, you know, often at meetings when we're at the municipal center, I feel guilty if people stay past their long work days to be with us at the meeting, people like Steve or Chief Bukowski or whoever, or police chiefs. And now I don't have to feel guilty that we're bringing them away from their home to not get a question asked. And now I filled time, and Daniel has a question.
Yeah, so that is a good segue, because I think, you know, one of the challenges with the whole working from home thing is that the work-life balance has become pretty imbalanced for a lot of folks. I'm fairly privileged in that, I don't know, I mean, I don't have too much to worry about right now other than the obvious big things that everybody has to worry about. I don't have kids to take care of. I don't have a dog to take care of. And I guess I'm thinking about those employees that are working from home. And we sort of talked a little bit earlier about like productivity and, you know, and how we're kind of providing services, in some ways business as usual. Like, I don't know, this is kind of a tricky question to ask, I guess, because I want our taxpayers to get value for their money, but I also want our staff to be taken care of and like their mental health to be considered and their family situations to be considered as we're thinking about like productivity at this time. So
thank you.
I just wanted to kind of put that out there.
May I speak to that? I really appreciate that. Thank you. And it is something that we're paying some particular attention to just in our relationships that we maintain with one another as a team of people serving the community. The public service that we provide, the fact that we're town employees in a small town, doing what we do is important to us. So maintaining as much of that is, I think, both not just a sense of obligation that we feel, but it's also a there is reward in that. There's comfort in that during this time when so much else is upside down. At the same time, yes, certainly the stresses of working from home, especially if you have children who are home from school, and so you're dealing with the intensity of not being able to have any kind of normal routine that gets you out and into different settings like usual is a real issue. And so as a team working together in town government, we've tried to pay particular attention to that and make sure that families and individuals are well supported. I think it's also important that the legislation that has come out of both the state and the federal government is mindful of those things. So there's some aspects to it that, frankly, without getting political, I was a little surprised at how far some of it went. I was pleasantly surprised at how far some of it goes to protect family interests at this time when that boundary between work and home is completely blurred. And we're also mindful, and this is not something that we in town government are able to address very fully, but it is a situation that is being experienced by some of our employees at the lower wage levels, and we're very mindful of that and trying to attend to it as best we can. That you mentioned privilege, Daniel, and there's some of us who are experiencing certainly a terrific degree of stress and change from this, but in relatively more comfortable circumstances, and others who are more vulnerable, both in normal day-to-day life and now especially during COVID. And we have members of our town employee team who are among those too. And so we're trying to make sure that we're attentive to that as we make decisions and take actions, both for the services that we provide and for the way in which we communicate as a team.
Thanks to both of you.
I just had a question that, Peter, maybe you would like to explain all the various things on the new website that people can understand the services that are done by ourselves and beyond us.
Great, thank you again, Liz. People are gonna think we scripted it. Throw Peter another softball. Yes, thank you for that. The website, on the homepage of the website, first of all, as it related directly to this meeting, which is now something that those of us who have joined us are well aware of, but in case the broader community needs to know, we did today, and we will every day when there is a select board meeting, post right at the top of the homepage the one-click link that'll get you into this meeting. So for people who do have computer access and are able to join the meeting online, that'll be as easy as going to the town's website anytime at 6 o'clock or after, in the 15 minutes prior to a 6:15 select board meeting. Click on that one click and you enter the meeting. The day-to-day, what was just down below that today and what is there every day is a 6-box COVID-19 information center that we've created, where the upper left-hand box is the town updates. So every day the town is pushing out whatever is new that day. There are days, there have been just a few of them, but there are days when the update is no change today. Most days there's at least 1 or 2 or 3 things that need to be shared about how things are changing related to this whole situation and related to town government. So those daily updates are posted there, and the whole history of them is there for people to go down and look at something old if they want to. Because it has now been a while, and because we know it's going to be weeks longer, it also occurred to us that there needed to be a summary of sort of how things evolved that people could look at. And so right up at the top of that list now is a timeline. So the timeline is for if people want to sort of trace the history. If you want the latest of it, what's actually the current status of town government, you want to go into the latest daily update. And that not only has the 2 or 3 bits of new information, but the current status of all town operations. The second box down is resources for businesses. And that is provides links. One thing I should say before moving on into talking about the other 5 boxes is the only box that we are posting information to is the town updates box. We made a very conscious decision that we're adhering to strictly that I think is really important in times that are so much driven by public health issues and so fluid in all different ways of different parts of our society. We're not There's information that we learn about what other people are doing, but we're not presuming to speak for them, even when we think we've got something that is accurate and reliable, because things are changing so quickly that we might have good information in the morning, share it in the afternoon, and end up being wrong. And so what we're doing instead, when it relates to Brattleboro Memorial Hospital, when it relates to business supports, when it relates to social supports for individuals and families, is we're posting links. And then people can access from the town's website the resources that are available from those who are keeping their information current about what they are doing in their area of specialty related to the emergency. So you got the town information up in that upper left-hand corner. You've got business information, several different links, both to BDCC locally, providing supports to businesses in southeastern Vermont, as well as to other business helps beyond, out at state government and so on. Down below that is an array of different links to help for resources that are available for individuals and families. And over on the right side, the 3 tiers are just in state, national, and global related to the health issues that are driving this whole situation. So the Vermont Department of Health link, the Centers for Disease Control and Prevention link in the center box, and then in the lower right, the World Health Organization. So people can come to the town's website and get straight out into literally, any scope or scale of health information about this through those links. And on the left-hand side, we're trying to provide the information that is helping people cope with the situation, the non-health aspect.
Thank you, Peter. And I think Ian wanted to chime in.
Yeah, quickly. Peter, can you speak to how individuals can participate in the select board meetings going forward if they don't have internet access at home?
Yes, thank you. So the information at the top of the website today and in a more detailed way on the warnings for every meeting will not only reference the way to link in with a computer, but also a telephone number you can call to participate by phone. So, and also BCTV, probably a lot of folks in town are seeing us right now on BCTV in the way that they normally do when the select board meets. Every select board meeting will be on BCTV, and we encourage people strongly who have computer access to please join the meeting online rather than by phone, because the way in which we're all going to communicate with one another is, as we'll see in a few moments when Tim invites public comment and questions, for folks who are going to come in and get on the screen and make a comment because they're connected online, that's going to be really easy for them and easier for us to manage in the sort of logistics of the meeting. It's much more cumbersome to deal with a phone call coming in, but we know that it's important that we allow that as another means of access to the meeting, because not everybody will be able to connect online. And so, frankly, there's going to have to be probably a little trial and error on that. I can call up the screen. I don't have the town's website in front of me, but in a minute, when somebody else is talking, I will call up the screen so we can announce to folks that telephone number in case there is anybody watching on BCTV who doesn't have a computer but would like to call in when it's time for public comment. We'll let folks know how they can do that. And as we experience it all together tonight, we're going to find out whether it's in the manner in which we think we can have that be orderly and helpful for people to participate. We're going to find out together whether that works or whether we need to adjust that part of the meeting, how we hold the meeting.
Thank you very much, Peter.
And I can give that number now. Will that not change?
That number will not change. We give just one quick thing. So none of the link information or phone information is going to change. One of the things that we did in establishing a relationship with GoToMeeting is, with the provider of the platform that we're on, is that we can have the same link work every time for a select board meeting. It is the select board meeting link. It'll be made active when there's going to be a select board meeting, and it'll be dormant when there's not. But people who are saving it and clicking in other than through the town's website will be able to keep doing that just by having the link any one time. And likewise with the telephone number for calling in, it'll always be the same telephone number.
Okay, thank you. Let me just give that telephone number really quick. That's going to be a toll-free number, 866-899-4679. So it's 866-899-4679, and that comes with an access code. That's 804-762-765. And we'll be writing that and announcing it more and more. I do want to move us along, being conscious of time here a little bit, and remind people that the way we're doing it right now, we're trying to have people, if you want to make a comment or have a question, just use the chat function to let me know. I'm keeping an eye on it, and a couple of people have asked to ask a question already. So that's our form of raising hand. I'm not familiar if GoToMeeting has that function that some systems do. So that's how you raise your hand to ask a question right now. And I just also wanted to say, unless there's another board member that wanted to say something, just to make two notes, because things are moving so fast with this new world that we're dealing with. We normally would have some sort of recognition for David Scholes. He served here on this board for 7 years, and I think we want to recognize that. But of course, this COVID-19 situation went down, and we haven't made any official actions or recognitions for that. But I did want to speak that out loud because I think it's important to thank him for his service. And also a shout out right to Ian, who is here with us, and because this is his first official board meeting. So welcome, Ian. And,
thank you very much.
Yeah, great.
Thank you, David, and welcome, Ian.
With that, I think I'd like to move into public participation. I do have a short queue, and the first person that asked me to ask a question was Olga Peters. So I think I do want to also shout out to Patrick, who is really behind the curtain. He is operating all of the strings and the bells and the whistles. So Patrick is assisting me, I hope, in bringing up Olga so she can, there she is, so she can ask us a question. So go ahead and let's follow the same protocol of where you're from, and I don't know, you could give us street or if you're a resident.
Hi, I'm Olga Peters. I'm actually in Dummerston, but I am a writer for the Commons, so I am here reporting tonight. I don't know if this question goes to Peter or Steve Barrett. I know there's still a lot that's really uncertain right now, but when it comes to town projects, especially our construction projects, this is usually this time where we're starting to send out bids and we're planning and all those sorts of things. what's going to happen to those projects? Are they just getting pushed back? Are things moving forward as planned?
The answer is some of both. Steve's on, and I'd like him to speak. We've got one in particular we're going to be bringing forward for an award on April 21st because we know it is a public health matter in and of itself. So it's a good example of the kind of things we will be continuing forward with. But certainly there will also be delays of some projects, either because it's just not practical to organize that work under these circumstances, or in some cases because out-of-state contractors would be coming in to provide to do the work, and it would not be appropriate under the governor's order. But Steve?
Yeah, Peter summed that up quite well. It's things that would affect health and safety that we're going to focus on. And again, in the wastewater, we have some manholes that we're going to reline. We'll be bringing that to the board. We're uncertain of the hot mix contracts, and we're aware how rough the roads are. So that's definitely a safety concern. But these are things that we'll go over with the town manager and the board to decide which projects we'll move forward with.
Thank you, Steve. Thanks, Peter. And then my other question was Millicent Cooley has also asked, so about representative town meeting.
Oh. Do you think it's the same question? We could just.
I don't know. Well, I'm wondering about what's the plan for representative town meeting. Do we have? I know we kind of pushed back the date, but are any more plans to make a remote one? Any more plans for a new date? Like, just what's happening?
May I speak to that, Tim?
Yes, please go ahead.
Thank you. So I think that the best thing, because of the time frame for tonight, I will say a quick snapshot comment on it, but because the goal was to be an hour or so tonight and we're 45 minutes in, and I think the RTM conversation itself is likely to take a while with some, good observations about could we do this or could we do that, or, the different statutory deadlines for getting certain things accomplished. That it would be better to save that for next Tuesday evening. It is an item of its own on the agenda for the select board meeting on Tuesday evening at 6:15. So if the folks who are asking about that don't mind waiting until then, we'll have a good, complete conversation. I can tell you now that it won't involve warning the meeting on April 7th to be held on May 9th, as we had hoped it would, because of the length of time that we expect the impacts of COVID-19 to be continuing to affect how we interact with one another. But we'll have a lot more to say about that on Tuesday.
Thank you so much.
Thanks, Peter. I think that's a good summary. It's not looking good for May 9th, in my opinion. So we also have Millicent wanted to ask a question. And Millicent, I think we'll make you live and you can tell us if that was the exact question and we'll move on. If you're still with us, I haven't looked.
Yep. Can you hear me?
Yeah.
Good. Okay. Yes, that was my question. The fact that we're meeting next week, I think is the, I'll just wait because it's as Peter said, there's a lot to that one. So thank you.
Great, thank you. Gosh, I don't want to jinx anything, but this is working remarkably well in my opinion. Does anybody else have it? Brandy says. I know, I had to do it. Chris Grotke also had a question. And maybe Patrick, if you could magically make Chris live. Or maybe I can, if you'd like me to.
Hello,
Chris,
hello.
can you hear us?
Yep, can you hear me?
Hello.
Hey, I'm really enjoying this
Yes,
meeting. First
absolutely.
of all, because you can see everyone's face and their names are spelled out underneath them, which is great for typing it up. My question is a really general one. Are there any known cases of COVID-19 in Brattleboro?
There have been, I don't know whether there are at this moment. That's one of the pieces of tricky business in terms of the publicness of the role that we all play in the community, and our interaction with others who are responsible for certain major aspects of how both the public health aspects of this and other, the business aspects, the family supports, all of that goes on in ways that are beyond the reach of town government, but we become aware of certain things. We aren't speaking for other organizations about that. So I know that the hospital has information that it is intending to make available in the form of a dashboard of some sort. I don't know any more detail than that. That will be posted soon on the hospital's website that's going to have that kind of information more continuously available to the community. I don't know whether it will include broader sort of health department level data about cases that haven't been seen or treated at the hospital, but are people who are isolating in the community. The Vermont Health Department is really the best source of information related to where cases have occurred and how many have occurred. And that data is being published daily on a county by county basis, but is much less readily available on a town by town basis.
Gotcha. Thanks. I've been checking the hospital site and it's been woefully inadequate so far. So I'm glad to hear that they're planning that.
Yeah, and I'll just say that, we have 12,000 people here in town, but it's essentially a very small town with a lot of interconnected Venn diagrams and interconnected people. And there's obvious reticence to release information because of HIPAA rules and all that stuff, but a lot of people know of certain cases happening, and it's a little frustrating, I think, at the town level, because we can't be spreading rumors, but I think it's important for us to all remember that we do know that it is here in Brattleboro, Vermont, and that we have to just go forward and act safely and practice our distancing and just realize that it is here like it is almost everywhere in the world. We can't feel like we're in any kind of special bubble. If we did for a little while, I don't know. And we'll be receiving some more concrete numbers hopefully soon about that. So I guess I'll ask, is there anybody out there who would like to make a comment or ask a question? We have, unless the names are made up, I have a lot of names, people watching, which is terrific. We don't have any call-ins, which I'm kind of relieved at because we were all worried about how to handle that, but we certainly can handle it. We're just not sure how it's going to work logistically. At least the way I interpret it, Peter, I don't see anybody with a phone symbol. Do you?
Tim, this is
I don't know.
Yeah.
This is Peter May. I was just going to say, probably figuring out a way for future meetings for people to raise their hand. Maybe we just have to use the chat here, but someone need to get some resources so that people can be recognized, in the future.
Thank you. Yeah, we said that on the chat feature. I did mention that chat would be a great way to raise your hand for a comment or a question. And speaking to that, I just see that Millicent would like to make a comment, and that's fine.
Hi, this is to Ian's question about people's participation. So there are people here in the community who are aware of the fact that not everybody has access to a computer and are trying to help. So Stephen Dotson, who is our new sustainability coordinator, one of the things that he is working on is trying to figure out how to get devices or internet access to people who don't have that. It's not a promise that we can do that, but I know he's working on it. And then I'm working through the BAMA organization, Brattleboro Area Mutual Aid, to look for volunteers who can provide tech help, because some of those people have those things, but they don't work in this context. So none of those things are promises, but there is an awareness that that sort of, quote, digital divide really matters in this situation. And
Thank
there's
you, Melissa.
people working on it.
Yeah, thank you for both of those, especially the Brattleboro Area Mutual Aid. That's something we should all talk about. That it's a great forum to both offer your services and help, and also request help, which is important too. There's some great examples of our community coming together, and it's not involving the select board or even town staff sometimes. It's just people stepping up, and it's terrific. So I don't see any other comments. And it is coming up on exactly an hour, which would make my promise be true, which would be awesome. So I think we're getting ready to wrap this up, and I realize that we have not had anybody make a motion yet because we haven't needed one. But somebody here who may or may not be our new member might want to make the very first motion to adjourn, if you'd like. Ian?
I would. Yeah, I move to adjourn.
Awesome. Let's see. We'll test the hands thing. All those in favor, say aye and raise your hand.
Aye.
Aye.
All right. That's unanimous, 5-0. Thanks everybody for tuning in. The 40 of you that came in on GoToMeeting and BCTV, as always. Hopefully we'll see that out there. And thanks to town staff too for taking the time. Thank you, Peter.
Stay safe. We love you.
Okay, we are officially starting the new Fane Select Board meeting. It is Monday, April 6th, 2020. This is the very first time that we're doing some virtual meetings, including Zoom and somebody on the phone. So Chris Williams is on the telephone, Shelley Hubert is on Zoom, Angela Sanborn is on Zoom, Mike Fitzpatrick, Jay Wilson, Lynetta, and myself, Marion Gowan, are here at Town Hall meeting. And in the future, if the public would like to join in our meetings, and this is probably the way it's going to be for a while. It's going to be virtual meetings. The town hall will be open to the public to come in and sit and participate. Tonight, we don't have any people as of yet. So, I'm calling the meeting to order. The first item is additions or amendments to the agenda. Is there anybody who has an addition or an amendment to the agenda, please? Okay. So we're moving to approval of minutes. And we have the minutes of,
Marion?
we have no minutes.
Two things I wanted to bring up to talk about was the emergency management plans, if it's been updated with the forms. It's kind of important that we all kind of know who is on that and what the document says. And also the town finance discussion that came through the Vermont League of Cities and Towns recommendations on how to handle certain things. I had asked Juanetta to make a copy of the town finance FAQs related to the COVID-19.
Okay, the first item that you mentioned, the people.
Excuse me? Oh, the first one, where are we on the emergency management plan update? Do we have the forms filled out?
Jay Wilson was here at our last meeting.
Okay.
And he reported at that time that basically he's following the emergency team is following state of Vermont rules. And we can have Jay talk about that maybe at the end of his road foreman report. The purpose of tonight, really, Shelley and everybody, is that we're going to try to get through this meeting without many extra things on the agenda, because some of us are sitting here without masks and gloves on. This is the first time we're trying virtual. And also, after this meeting, Angela and Mike have to stay here for quite a while doing the pay orders. So, because it's the first time working on all of this, I think Jay can talk about emergency.
Well, I think I can, we can wait on the emergency. I just wanted to know what the update was, because I know there are forms that need to be filled out, and I think each board member should have a copy of it. So in the future, let's put that back on the agenda as something as a follow-up. And the other is the town finance discussions. I think we need to discuss some of that. That needs to attention.
Is that an emergency?
This isn't an emergency meeting. This is a regular board meeting, correct?
Yes, it is. But tonight we're only working on things that have deadlines that we have to deal with. And also a letter from.
Well, I think it's going to come up regarding the.
We'll put it on the future agenda.
People.
Chris?
No, excuse me.
Oh.
Never mind. I made my table and I'm saying what I think.
Well, I think it's really inappropriate, Chris.
You think it's inappropriate? When I sit at my table, I can say any goddamn thing I want to. Well, just realize that.
Okay, Chris, can I just remind you that this is going to be on public TV?
I don't care.
Well, I'm asking you to please be respectful to everybody the way we will be with you.
Yes, okay. Thank you very much, dear.
Okay, thank you, Chris. Okay, so we don't have minutes to make.
Oh, I got somebody off already.
So can we just table the minutes for the next one? It's not a big rush. And keep moving right along, please.
Make a motion to table.
I make a motion to table the meeting approval of minutes till the next meeting that we have, date uncertain.
Okay, Mike second. Any discussion? All those in favor say aye.
Aye.
Okay. I'll have it and we'll postpone that for next meeting. Okay, the next item on the agenda is road business, and it's the road foreman and road commissioner report. Start with a motion, please.
We had another burglar alarm at the town garage Friday morning. It's the same motion detector as 2 weeks ago. The home security came, replaced that detector, and replaced all the batteries.
Excuse me, Jay, can you speak just a little bit slower? It just comes muffled. Thank you.
We had another burglar alarm at the town garage Friday, and it was the same motion detector as 2 weeks ago. So home security came and replaced that detector and replaced all the batteries in the rest of the system. The permitting process continues on the sand salt shed and the Depot Road box culvert. Both of those, the people continue working. Still doing stuff. They're falling partially over and taking the back with it on South Woods Road. I'm working on somewhere to remove the trees. Mark Pickering and Scott Jensen are looking at it to come up with a plan for permanent repair. We're busy getting roads repaired from mud season. And I've been on a daily basis wiping down all the common surface Clorox spray at the garage, either after everyone has left for the day or before they come in. We're doing our best at having people drive only one vehicle or wiping them down if we do have to spray. If this goes on for a couple months, it's going to be a very annoying process.
I'm not sure what he said.
Wiping down everything.
They're wiping down everything with chlorine.
Okay, so my thought here is, again, if it's not a, what is it called, like an emergency, I don't think that the highway crew should be out unless there's a failure in a road or a bridge, et cetera.
Well, that's what he was saying. They were fixing a spot on South Warsboro Road that needed to get done for people that need to drive on it.
But is the staff on duty now, though?
Yeah.
Because the governor has made an emergency declaration, and it's only for essential services. So unless there's an issue, I think we need to discuss about what their role is, and if they're not essential, they should not be out working. There's $1,000 fines that are going to be imposed.
The highway crew is considered essential employees.
Right.
May I say something?
Yes, Chris.
The town crew works on the road. They aren't together. They're working on the roads, grade the roads. One fifth person is doing one thing, one person's doing another. Let the road crew keep working on their road. If you don't, you're going to have a real problem. Thank you.
Thank you, Chris.
I just wanted to bring it to your attention.
Well, I think that the roads are very essential.
That's it
Because it specifically talks about municipal employees and road workers. So I don't know if we need to call a vote on it. It sounds like you're all, allowing this to happen. So, I mean, I'm just worried about people getting sick.
May I say something about that?
Yes.
These gentlemen work apart. Jay has separated them. Each truck has a driver. The loader has a driver. Everybody has a driver. They're not doing anything that makes everybody sick. Now, let the road crew do their job if you don't know what the hell you're talking about. Thank you very much.
Okay, my suggestion.
Chris, it's really inappropriate the way you're talking. Really inappropriate.
Okay, Shelley, I would like to say that probably, but my guess is that Jay Wilson and Chris, who are the people who oversee the roads and the road crews, would not be working if it was detrimental to anybody. I think right now what Jay and Chris are saying is it would be detrimental not to work on the roads because it's a very difficult time of year with mud season coming, trees falling down on the road. It would be terrible if they didn't work. So in my opinion, and I think in others, it is considered an essential job.
Mary, can I say one more thing?
Yes.
The road crew is working on the roads. They're working, just like I said, separated. They're doing what has to be done. And if the town would leave them alone and let them do their job as it needs to be done, everything will get straightened out. Everything will be all right.
Well, I think as a select board members, we have the right to have questions, to make questions about what's going on and to follow the law.
Shelley, it's fine to have questions, and that's not the problem. The problem is that I think that right now the road crew.
I get it, Marion. I understand that the springtime, the roads need work.
Yeah.
I understand that part of it.
No, so I'm saying that Jay as a road foreman and Chris as a road commissioner, I think are going to be the ones who know the best about what is important and essential for us.
Yes, but Marion, we are select board members, so I mean, there are staff. They're hired to do the work of the town. So, I mean, if you guys want to make a ruling that we're going to overrule what the governor's law has stated, that's, I'm just stating that I'm not real keen about it.
But that is only if they're considered not essential. If they're essential employees, they can still go out and work. And unfortunately, with mud season, our dirt roads need to be taken care of. They can't just sit and wait.
Hello?
Well, I'm just saying that if they're not out, if they're out there doing an emergency thing, that's one thing. We have a gentleman over in Wilmington that died of this virus. It can happen to any one of us.
Like I told Jay, I said, the town of Putney over there, the crew is not allowed to drive.
Can you speak up, Mike?
Town of Putney, when I was talking to Karen, their road crew's still working. They're not allowed to mingle with the drive through like that. You can't went out to lunch and stuff like that. They're there, they're assigned a vehicle. They all come in the morning, they get the vehicles to go to work.
Well, that's what Chris is saying.
But I mean, right now, they're still running out the drive. Still running out the drive, and just like that, for one thing, Christopher probably shouldn't be done. You know?
Okay, so is my understanding that when the men show up from work, they go into the garage to get their vehicles, and then one by one, with their each their own vehicle,
So
they
Bucky's
leave?
actually parked all the vehicles outside. They don't do them outside, they're not in the garage, not allowed to. You can find-
I can't hear what they're saying. Can you, Angela?
No, I can't hear Mike.
Yeah, what Mike is saying that is that in Putney right now, the garage and road crew people are not going into the actual building of the road crew. They are picking up their trucks which are parked outside. And I think right now without the snow anymore, you could probably do the same. Right? And then the gentlemen just come in the morning and pick up their vehicle, and then they go off on their own to the business.
I think that's fine. And then I also think that if any member of the road crew feels that they shouldn't be at work, they should take it upon themselves to talk to Jay and explain that. I mean, we all have that decision, whether we go in or stay home. You know, anytime you should make that choice for yourself.
They're aware of that any one of them are welcome to not come in. So, there's days like you get a heavy rain, you can't go out too much on the road. What do you want to do? If they stay home, how do they, do we still pay them? How do they do it? I don't know how to.
Oh, that's a good question.
I think the road foreman should work with the road crew, tell them what's going on, tell them how things are, let them do it themselves. I don't think we should micromanage them and tell them what the hell's going on. They know what's going on, they know if there's a problem, they know if it shouldn't be there, they know everything. Those people are not ignorant people. Just leave them alone, let them do their job.
Mike Maine has the butchering to do so with Dr. Well, and they gave whatever.
I can't hear him.
That's fine, but I just didn't know if we have a day where we feel we can go out and do something separately. How do you want to handle it?
Jay, I think you have to be a little close to tell it easy.
I don't like this whole thing no matter what either, you know, I mean, honestly, like I said, I'm no different than the grocery. I go to work and buy myself. As of tomorrow, they're gonna find out I was looking up. And I said, I don't know why the hell, what's the difference between us and the road crews or anybody else like that? There's a lot of jobs, a lot of guys that are logging. They're working by themselves off this. You know, they don't see nobody, you know. Yeah, just to come out of this water, that they don't start finding everything, people go to work, you know, and maybe they'll have to be in money backing it up.
I can't hear Michael.
Michael was saying, he's talking about the rule that's supposed to be in effect as of tomorrow, that people shouldn't go to work. But at the same time, it's essential work that the road crew has to do, that Mike and other people, loggers have to do.
Oh, I know, I said, we're no different than the road crews or anybody like that.
They're no different than the road crew.
You know, we're not with a bunch of cops. You're by yourself all day long.
Right.
And all that stuff like that, but then tomorrow, they can either find here, they even said they even could put you in jail.
So, Jay, I was out calling the state first thing in the morning and saying, did the new thing go through for me? We would like to know.
I mean, I know this is serious shit going on.
No, I know.
It's really going to be looked at, no matter, but I mean, can't just take it for granted. I mean, you know, we all know how very home to it. I mean, it's not good. But, you know, I mean, on the other hand, too, you know, people have to survive, you know. You can't just shut everybody. I mean, places they tell you can go to work, and places you should be going. That's the stores. You know, you go in there and there's 100 people in their shop and tell you to get in, you got the place, you know. And that's everybody's all right, you know, you can go to that.
Well, would everybody agree that Jay could call the Vermont State tomorrow, the governor's office, whomever he has to call, and ask permission and see what they say about road crews being essential?
Sure. That sounds great.
I agree with that. Can everybody agree with that? Kelly, do you hear me? You're muted. Kelly, don't mute.
I didn't hear what you said. Sorry.
What I'm saying is I would like to have a vote, so to speak, in terms of having Jay call State of Vermont tomorrow morning when he gets to work and ask, is the road crew considered essential for the people to work on the roads where their trees have fallen, where there's mud, or do they want those people to stay at home also?
Yeah, I think you need to get clarification. It's in case of an emergency, yes, I could see the road crew being out there, but it's supposed to be, everyone's supposed to be staying at home and away from other people.
I want to know what the governor's office says to Jay as road crew on him. I can't hear you.
I said I read it. I read the material. What's essential?
Get them going. The guys are not working tight together. They're away from everybody. Let the gentlemen do their job.
Okay, well, I guess we're going to take a vote on it. I think Jay should go and contact and get the essential, who's essential, and regarding the road crew.
Does everybody agree?
Get clarity on it.
Andrew, is that okay with you?
Yes, that is fine.
Thank you. Chris, is that okay with you?
Repeat that to me, please.
That I suggested that Jay call the state of Vermont first thing tomorrow morning from the road crew garage, and ask if they are considered essential workers.
Yes, no problem.
Okay, great. And Mike, you agree? Okay, we all have voted yes, that Jay will call.
Great.
Yay.
Yay.
Thank you, everybody. We need a motion now to accept Jay's road crew. Okay.
I'll second.
Okay, any further?
I'll second.
No. Okay, motion and Jay's report. And Chris. Okay, moving right along to administrative assistance report.
A very brief one. I've been working from home remotely in the evenings, checking emails, looking at the mail, talking with Mary and setting up conferences and planning what's going to be essential to the select immediately, and just trying to keep things moving and efficiently.
Also, whenever you're doing training with BCTV to get this Zoom on and to get the office working to have this happen. And Peter, who is the assistant to Carroll Town Clerk, has been in here working with Renetta this afternoon and maybe before that. So there's good teamwork going on in this building.
That's wonderful.
Is there a motion to accept Juaneta's report?
I'll make the motion to accept Juaneta's report.
Further discussion? Discussion? No, thank you, Juaneta, very much. Okay. Now, we don't have any unscheduled events to cover. So we are moving on to the important business at hand tonight, the old business, which is now has a time limit to it, and that is to review the lease agreement for the cat excavator. And the question will be to consider renewing the excavator for at least another year or return it. And we need to know this within a few weeks.
I'll make a motion to renew it for another year. Thank you very much.
Okay, is there a second to that motion? Okay, we have a second in order to discuss it. So now discussion. Jay, do you want to start?
So the guys have their ideas of what they would like. They feel the tracked one that's a little smaller would be handier. Logistically, I think that could be a nightmare moving it around all the time. It has to be trailer. This one's nice. You're able to drive where you need to go. So it's very hard to find one machine that will do everything we want to do. I think this one's a little more versatile than a smaller tractor would be. I just can see if we were able to go through the covered bridge with this one, we're able to sneak through, whereas the other one we have to go over the.
Can't hear you, Jay.
We're able to go through the covered bridge with this one, and if we had a tracked one, we'd have to go over to the piece work, which if it's slippery at all isn't always good. I don't know. I think we've been able to do quite a bit of stuff with it.
How often is it used?
We put about 340 hours of move on this summer.
40 hours in the summer?
So we've had it for a year. And so what are the projects that have been done up with it?
Like two spots. We did ditching on Newfane Hill. We did ditching on Hillsville. 20 plus culverts. We did the work for the Hunterbrook bridges, moving of the old ones and the.
Can't hear you.
What was that?
Can't hear you.
We did the Hunterbrook bridges with it. Pulled a number of stumps and rocks that were, hitting lanes and plows. Quite a bit of stuff that we haven't been able to do with this tobacco before. We had a rock that was thrown inside of a small car. We got out of one of the roads. So,
Have you been able to use the brush cutter?
we used it some. We ran into a lot of problems with neighbors. The power company had come through and everybody was still a little raw from all the cutting they did. And so it was a lot of people were coming out and questioning why we had to cut the road back and so forth.
Why you were cutting it back?
Yes.
Really?
Did you say 340 or 500?
340. I think the normal usage for town was like 3.
I can't hear you.
Looked up what they usually figure the hours. They base our warranty on how many hours the towns usually use them.
Yep.
The range was 350 to 500 hours was the average for a town per year. The machine that we rented the previous year,
You have to sit forward, I think, to project.
the machine we rented the previous year, the wheeled excavator, was $5,900 a month, which comes out if you rent it for the summer, like $29,000 or something. If you rent a smaller one, I think it comes out to $20, something like that.
Well, track one, they'll cover 3,500 a month.
Right.
And like I said, you wouldn't have to rent for summer, you can rent for fucking.
I can't hear what Mike's saying.
No, the thing is, if you're only putting 300 hours a year on it, that figures up to like $100 an hour. Right?
Yeah, it's cost-wise.
Losing it, and then you got the guys running it, you got fuel, you got carry insurance. Almost to the point where it's a lot cheaper to hire someone just to do the work.
So you're saying the cost of using it versus the cost of renting something or buying something, it kind of is the best situation.
Kelly, wait, let him finish and then you can talk.
I couldn't hear him.
Yeah.
Oh,
Like I said, if you put on roughly 300 hours or so a year, that's $100 an hour.
Right.
Then you got the operator running it, which is costing, what's a guy cost it down, 30 some bucks an hour? So then you got 130 some bucks an hour there. You got your insurance on that. You got fuel going. That's where you're done. You're spending probably. You're probably spending goddamn 150, 60 bucks an hour for that machine. Where you can hire somebody for a hell of a lot cheaper.
A lot of our ditch work, though, you can't just do all of it in one shot. You have to do pieces, place the culverts, so the machine sits a lot. Whereas it's not like you get to go out and run it for 300 hours. It takes you months to get that done because so much time has to sit while you do the other part.
Like I was saying before, right? And this grant money, that should be off the market by the time. You didn't have that should be good, but you get a better deal. People, if they put a contractor to do it, they can count it. And furthermore, it takes away from the town doing the maintenance on the road. The way I look at a road crew, it's a road crew is the maintenance. Many of them do it on the road. And they never have, and most of them don't. They just doing the project, they put it out there. And I think that's the way to go. I mean, especially if they right now, they got people out of work, get it done for a little now. I'm not the, like I said, when we first started about getting one of these, we were looking at renting a nice, get a good used machine for when they're out grading the road, they can pick that up. Everybody I talked to just think this thing's way too big for our road. I don't really give a shit one way or the other. I've had a lot of people back there who just opted to do it.
The grant money paid for $16,000 worth of it this year.
so 16,000 is paid. About 13,000 is paid, but people got the county. Is that a grant that you can apply for on a yearly basis?
Yes, we apply for 2 every year. And we've got 1 so far.
That's the good word. That ain't we're doing. What he's saying is, by what they get by hours on it, you figure so much an hour, that they get that out.
If not, well,
No, you don't, they're not just gonna give you a grant.
They give you a grant to do the work, all your equipment, so our backhoe gets reimbursed, our dump trucks get reimbursed, guys, based on how much you use.
so the grant is also for salary. So let's say we didn't use, what was the alternative? Anybody?
Reduce 140, you need to put it in, send it back.
And how much is that?
That's the one that set up grocery shop is out there.
Can you hear? No.
The one they thought they wanted is $3,500 a month. For the rubber trash, for the buckets and all that stuff.
So that's more than, but it's.
Marion,
Yes.
I make a motion to renew the lease. The taxpayers have paid it. They have already offered it. Renew the lease for another year. That's what I got to say.
They've already come back. Nice set. Now we discuss it.
Yeah, you made that motion, Chris, and Michael seconded, and we're in the discussion period right now.
Okay.
So we're considering it.
I think what we should do right now is go over it for the next 2 weeks. There's no way to get out of it. So I do say I think these grants. The broker has always got plenty to do by maintaining it. You know, last year when they were up on Sunset Lake Road, they all get off and they put them behind over a month and a half because they were working on that road. They're working on the town road.
We can't hear Michael.
I'm just saying, I think what we ought to do tonight, we'll look this thing over a little bit more, take it the rest of the next, between now and our next meeting, look this contract over, go through it. And if you can't get out of it, so you gotta rent it one more year, we'll rent it one more damn year. But like I said, I still think all this grant money that we get for different things can be put out to bid. And the guys, they only use that to work on the road as maintenance. Use it for that. I heard that the head got that too, and that one, cutting brush. You got first use it. Now that's so much, they said that that's a vibration to it now too. That's what they said, they thought. Be like a balanced shack, right? I don't know, I tried it. Well, it's really good. But I mean, balance, there's vibrators, it's gonna pull the bearings out of it, you're gonna see it out of it.
I would like to reword the motion, and I don't know if that's allowed with that. So you correct me, you and Chris is correct. But what your motion is to look over the lease and see if you can get out of it. If you can't get out of it, then we'll lease it for next year. I would prefer to say, to make a motion saying that we look over the lease in the next 2 weeks, not with the purpose of getting rid of it, but then making a decision based on real facts. Should we keep it? So that it's still, we're not wiping it out. So that we can be respectful to both
I mean,
sides.
it's just like what I said that one last year.
Can't hear you, Mike.
I said what I said last year, even when we got it, I didn't like the idea of just putting it as a lease payment or rental equipment, And the thing, I'd rather have go as a damn article in the town vote if they want to buy it. But like I said, right now, you're hearing bucks on this in the morning. That should have been put into an article as in the warning. For us to vote to spend $30,000 a year to purchase this estimate, right?
Yes.
Right now, we're all, right now, every year, we're putting in rental equipment money to be paid for rent. Doesn't say that we're buying it.
Well, no, I remember talking that whether we would buy it or rent it.
Mary, we can't hear you.
Chris would like to say something. What would you like to say, Chris?
I got one thing to say. That loader we bought, it's the same type of purchase. And that was perfectly all right. Nobody complained about that. Now, what the heck is the problem? What we're doing now? Thank you very much.
Because it says that it goes to that loader, doesn't it? The payment every year goes to that purchase, that loader. Bratt divided the bucket. This is just in there with a bunch of money. There's not a separate line item that says that. There's a grand total of X amount of dollars that they voted on to put in the budget. What I'm saying is if it should have been put as an article, that's what Caterpillar is saying. We should have an article in our town report saying that we were going to allocate $30,000 to rent and purchase the rubber tire excavator.
Are you talking about this year's town report?
That's what the Caterpillar thing says.
That's what the lease actually says that we should have brought into the town.
So I think what we should do is take this thing and get a rejudge copy, let's look it over, talk back and forth with the Caterpillar guy. And if there's no other alternative, we're gonna have to pay $30,000 this year. Another year, put it in the goddamn article that we're gonna vote on. Everybody knows it. If they don't like it, they come and vote the thing out. You can even have it go into an article like the all strategy ballot, not just a show of hands. Throughout the day, people come in, they put their yes or no if they want to purchase that thing. If they don't, the thing goes bye-bye.
Did we get that, Shelley? Shelley?
I hear it.
Okay, Shelley.
It's better if you speak towards the computer, I think.
Okay, what Mike was saying was that, I think what he's saying is that it's possible that we might have to lease it again.
Yes.
But we have to talk to the person, the company who owns the excavator and talk about the lease. If we don't return it, then Mike is suggesting then we have to rent it, lease it for one more year, and then it must be an article on the time when town meeting comes where even the public would be able to vote on having this equipment being leased the third year or not. Is that correct?
Well, you can vote it on at one time, to put this money in every year, to go to a rental purchase of this excavator. Right now, we're just throwing this in as a one thing in the budget. So the, like I said, it's comes up to about $100,000, $120,000. It's crazy for different things. And half of them don't even know what it's for. Now, they prove it. And according to Caterpillar, it should have been voted on at town meeting in an article, unless it says it's one that you removed.
Well,
so that was overlooked.
Caterpillar didn't say that.
So as I said, we'll have to go over this thing, talk to them a little bit, see what it is. So they can't get out of it, we'll have to lease it one more year. Come down meeting, then we get it as an article. We'll get the vote on it, we'll show you the ballot throughout the day, just like we do the rest of the thing. And at the end of the day, they say yes or no, there you go.
So it seems that it could have been voted on at town meeting this year as an article. And for whatever reason, that didn't happen. So Mike is suggesting that we might lease it again for one more year. That we might have to lease it again for one more year and then put it in an article for town meeting day where the public will vote on whether to spend the money on this excavator or not.
Well, I read the lease, and the lease did state that it had to go before the board for this last town meeting.
Right, but it was overlooked.
I understand that.
Okay.
Well, let's just go through the paperwork.
Can I speak, Marion?
Yes, Chris.
Okay. We both do it. Then it's gotta be, put it on a ballot. whether they want to purchase it or lease it for another year. And that will make things very much simpler.
That's the way it was supposed to have been done.
We're gonna look everything over and then.
I looked it over, but I don't think everyone else has yet. But I think we're obligated for another year.
Yeah, we've looked it over.
Yeah.
We've looked it over.
Excuse me, I realize that we're obligated for another year. Now, we've got to work out what we want to do future. Now, we've had it 2 years. It might be smarter for the town to buy it outright after that. You've got to look at the purchase price, what the town can get, buy it for, and it might be a lot smarter just to buy it.
Well,
Off that. I don't know how I'm not making any sense. But
no, I understand. I think we understand what you're saying. And I think since this is an issue that we want to have come up on next town meeting day.
Correct.
In 1 year, a little less than a year, we have quite a bit of time to make sure that we will put an article out, we will discuss it, we will go over the leases, we'll make sure that it'll be done correctly.
Does the rest of the board agree with me or not?
Do you agree, Mike?
Well, that's like I said, I want everybody to copy now, the story is complete.
Yeah, we're gonna go, everybody.
Next meeting, you know what happens.
Well, I just like to say that we can get out of the lease, but we would have to pay a penalty, and it would be, if we wanted to push it on the lease, so that we could break the lease. But at this point, if Dave feels that he's going to be using the machine and it's worthwhile, we're into it for another year. And when it comes back up for next year before a town meeting, we need to get it in as an article, and we can discuss it prior to town meeting day.
That's what I just said, that we have almost a full year to discuss this now.
Right.
We reviewed the contract, and we will make sure that before town meeting, that everything is in place to put an article into the town meeting day and be voted on.
Now, the article should be put in, what to redo it, what to purchase it.
Well, that's something that I think we need to decide as a select board at the time.
Oh, all right, I'm just telling you like I feel.
Right. We're gonna go. Right. We're going to go through the lease next meeting. Everybody has a copy of the lease, is that correct?
Yes, and I think we should also ask the dealer to give us a summary of what the lease requires us to do. And and what it would cost for us to get out of it if we chose to do that.
Okay. It's in the agreement.
That's what I said. But between now and the next meeting, we'll all read over the contract. I didn't have a chance to read it, and then we'll decide by that point.
Right.
Yeah.
Right.
I mean, there's no sense of point down there, it's all here. I haven't looked over there. I think Shelley's looked over it.
I looked
it over.
We never mind.
So,
Spent a long time.
I mean, it's just like I said, what you told me the other day, that wasn't in the article, the vote on it. If someone pulled it out, you could get out of it.
I can't hear you, Mike.
Well, then talk to them. I don't care if we keep fucking them or not. I don't care. He's been saying it all night. So.
Okay, we're gonna clean it up.
Now, I just want to say that I want to go this thing, we got till the end of the month.
Yes, we're going to do that.
Right.
And our next meeting is the 30th. No, we're on the wrong calendar. Sorry, that's the clock.
20th is our next meeting.
April 20th. April 20th is our next meeting, God willing, we're all here in the live window. Okay? Is that good for everybody? Angela? I can't hear you. Can't hear you.
April 20th?
Yes, Angela, you're not on. Angela? Nobody can hear you.
Are you muted? Muted?
You say yes?
Yes, you will.
Yes, okay. Okay. So, do we need to vote?
Okay, so can I make a motion that we contact the dealer?
No, we have the motion already on the floor. Motion on the table was.
So you can vote on that, but then I wanted to make a motion to contact the dealer if we're not going to do that.
So we're going to vote on that motion and put another motion.
Because it only references the meeting on March 3rd, 2020. Hello?
I think it's including, Mike has offered to go and talk to the lease person.
Yeah, but I think we need it in writing. We need a statement in writing from the dealer so that we all have it in black and white.
I will have that done. Who's going to go with you? You and Jay? Jay and Mike are going to go and talk to the dealer and have it in writing, whatever the decision is. And we will discuss, we will vote on it.
Regarding how we can go forward as far as another year.
That's what we're talking about.
The motion on the table was Chris made a motion.
Yeah, I know, Marion. I just wanted to clarify because it's kind of hard to understand what's going on.
Mary, the motion on the table was Chris made the motion to renew the lease. Mike seconded it in order to discuss. So we need to have a vote on that motion or amend.
Can't hear it, Juanita.
The only one that can amend the would be the one that made the motion.
Can you hear me now, people?
Yep.
You can? Yeah. Good. I'm all set. Haha.
I can. But I can't hear Juanita.
Somebody is doing a motion. You can vote on the motion. So the motion was made by Chris to review the lease. I seconded it in order to discuss. You either need to vote on it that way, or you need to amend the motion. Anybody can.
That's the case, and I guess we'll go through this contract and our next meeting, we'll vote to.
I can't hear it.
Okay, so Mike is making a motion that we're going to go through the lease during the next 2 weeks. We're going to read the lease, and you also should add that you and Jay will go and talk to the dealer. That's part of the.
So that is an amendment to Christopher's motion.
Right.
Okay.
We will meet at our next meeting, April 20th, and vote on it. Okay? Is that good for everybody?
Can I second his amended motion?
Yes, you may.
I'm seconding his amended motion, please.
Any further discussion before we vote on it? Okay. All those in favor of the motion that was made, that Mike and Jay are going to talk to the dealer during the next 2 weeks, and we are going to reread or read for the first time the whole lease, and we will discuss that at our April 20th meeting and make a final vote. All those in favor say aye.
Aye.
Chris?
Marion,
Yes.
I'm the road commissioner. Whatever I say doesn't mean shit. Thank you very much. I'm all done.
Are you going to vote?
No, I'm not going to vote.
Well, Chris, we had your motion and we added to it that we were going to read over the lease during the next 2 weeks. And Jay, okay, and Jay and Mike will go and speak to the dealer, and then we will come back and discuss everything that was found out and what we read, and then we'll vote on it next time. Are you willing to vote on that, yes or no?
Yes.
Thank you. So the ayes have it, and the motion passes. Okay? Thank you, everybody. Okay. We don't know, we have to find out.
We can't hear you out here in Zoom land, folks. Just saying.
It's really frustrating because you guys need to project your voices.
Would you have everybody on Zoom? No.
Next time we need to get a microphone on that table.
Right.
And then we come up with this, but I mean, we're doing a whole freaking agenda to try and bunch of things. I don't think we're not supposed to be hanging around together. We shouldn't be hanging around. And then we're yelling.
Mike, can you lean forward?
I said, I don't really like this whole TV deal, you know, because we're not supposed to be hanging out, and now we're having to yell at the top of our damn lungs so you can get it so everybody can hear me. I said, our last meeting, the only thing we was really going to be doing was
pay orders.
To do the pay order.
Well,
This is turning into a full meeting.
Yeah, because we found out about the deadline, which you, the ones who pointed out to us, thanks, which was great.
Which I think probably was totally handled, you know, on the side. I don't know, but it's.
How would you handle it?
Marion.
Yes, Chris.
I agree with Mike 100%. And this is a bunch of BS, having a big blowout meeting. And I disagree with it. We voted not to do it. And Mike's 100% right.
We voted not to do what?
Have regular meetings. It was just supposed to be Mike and I getting together to do pay orders. Because we're really not supposed to be hanging out with each other around a table.
Right. No, I understand that, but
people don't like the Zoom meetings, which is frustrating because we can't hear everything. However,
you guys hear each other all right?
there's still
oh yeah.
We need a microphone on the table.
I can hear Shelley and Christopher clear.
So if we were all, then it would be easier.
Right.
Yes.
Then we have to, what we have to do is.
Well, you have to have two people come in and do the pay order.
And that's supposed to be myself and Mike, so that's fine too. I could also do a Zoom meeting in another room at the town office with my laptop, so that's fine too. It's all good, but I think we need to start wrapping this up and moving along so that we can get all of our business done. And
Fine with me. Everybody got a letter, I think, by an email from the letter that Bob Fisher wrote a letter regarding the select board to follow the oath of office, particularly about when to do that we cannot change things. Please read that letter. We can go into correspondence.
have we all read that letter? Do we need to make a motion or anything to accept his guidance? And
I haven't read it because I got it late this afternoon.
We didn't get it on Wednesday last week when I sent the agenda.
Yeah, I was here when she sent it out.
Oh, I didn't get it. Sorry. I just saw it this afternoon.
Yeah, I was sitting with Winetta when she mailed those out last week.
I personally do not think that this is an emergency that we need to deal with this evening.
Okay.
Personally.
Okay, we're not having executive session. I and Angela are going to be doing pay orders, so we can adjourn.
Make a motion to adjourn.
Thank you.
Thank you. Thank you, everybody. We'll be in touch about how to do this on April 20th.